Berlin Finance Committee. Open session public meetings are subject to being recorded. Your image and voice will be recorded. All right. All right, we'll just get started with the fire since we have it up. We'll do our minutes at the end. Let me make sure we don't forget that.
All right. I think you're up.
All right, well, this is my first time going through this, so I will try to give you the best information that I can for where we're at. Last year when I arrived, we finalized the contract with the firefighters union to give them pay raises and kind of put them in line with area departments and put them in a place where hopefully we could retain them and not lose them to other departments.
Sorry.
Kind of going through this year, it's like, working through the budget, trying to meet their salaries and the increases within my current budget. But what I did is I adjusted their budget lines to meet those requirements in the contract that they have. And that's the full-time wages, the 194 and the 255, going to 255 that exists there. The part-time wages for line number 5114, that is my per diem and my call firefighters. So they're the ones that cover the shifts at night and on the weekends and, at the night through the weekend and also one-day position. And that basically, I increased that, I believe it was 2.5% is what the increase was. 2%, I apologize.
Oh, no, I'm sorry, because it's union.
Yep.
You were 2.5.
Okay.
No.
Yeah, I might have done that. I think I'd have to go redo my math on that. I think that's a 2.5%.
I think you're right.
That looks like 2%, right? Then 300,000. I mean,
Yeah.
2,000
Oh, you're good at
on
math.
every
Yeah.
100. Like,
Yeah.
Yes.
Okay.
Okay.
So I did do that one correctly then. Okay, thank you. And that's what represents there with the part-time wages.
How many you have on staff right now, full-time and?
Full-time on staff, including myself, I make number 4.
Okay.
So I have 3 full-timers, and then the rest are all per diem or call firefighters.
Mhm.
How many are there?
Right now, I believe I have 22 that are on the roster, and not all of them are as active, not all of them are taking shifts and stuff. That's one of our biggest problems, is that we used to have a little over 30 that were on the roster at one point in time. But the trend across the country is, unfortunately, it's trying to recruit call firefighters and volunteers is very difficult. I am happy to say that I have 3 that are getting hired. Hopefully the paperwork will be completed in the next week or 2. We've gone through the background checks on them and everything else, but it'll take me probably another year before they're trained to a point where I can use them. Trying to reach out, I do have some programs that I'm working with Assabet and some of the area departments and stuff to try to encourage people to come here to be call firefighters. What we're finding is a lot of them are looking at doing this as a full-time career and they're starting here, but even if we can get 2 or 3 years out of them before they move on, it's 2 or 3 years that we don't have somebody. So, we're trying to look at different ways to attract people to come and give of their time and be with us. So hopefully, knock on wood, that'll continue to move in a positive direction.
Is there academy like law enforcement where you have to go?
It is. It's through the Department of Fire Services over in Stowe. They offer them in other areas of the state as well. So
Okay.
they have a couple of them throughout the year, but it's usually about a 3 or 4 month commitment for them to get through.
Yep.
And then on the EMS side of things, it's probably another 6 months for them to get their EMT so that they're certified to be able to be on the truck and be able to operate.
Okay.
And then in that period of time, hopefully, that first year when they're going through that training, we're also doing a probationary period with them so that we're onboarding them and they're going to be good to go
Right.
once they have the training.
Okay.
If I may add something too, when we did the union negotiations last spring into early summer, we did a pretty extensive market analysis of comparable towns. I think we looked at 8 or 9.
Right, yep.
I really pushed the union because they gave me a few towns. I said, I don't like those, give me a few more. I'm not sure that I agree that's comparable in terms of region, location, as well as size. So
Yep.
it's really tough actually to find both size-wise and region-wise comparable comparable towns rather. So when it all kind of shook out, what we did is we averaged the low of end of the range, averaged the high end of the range, and the salaries in the last contract, which was the first contract that the fire union had, they were woefully underpaid. And we are reflected in the number of empty shifts and vacant shifts that you have and people going to other towns. So it is a large adjustment. It is something we discussed as an important issue for retention, attraction and retention, because our biggest concern is should there be an emergency in town, we need to have people there, and lots of shifts going unfilled is a problem. And it does take time. These new wages went into effect July 1, and takes a little bit of time for that to get out there that, hey, Berlin's adjusted its pay, we pay comparably to other communities around here. But I think hopefully we're starting to see the benefits of getting some new people in.
Yep.
That's good information, thank you.
Your shift's 12 hours, 24?
Yep, they work 6 in the morning till 6 at night.
Okay,
and
so
that's
12-hour shifts.
Yep. That would be, I have 2 full-timers that rotate 3 days on, 3 days off. And they have
Okay.
a day shift. And they have somebody that works with them on that same shift. And then I have the 2 per diem night shifts that are 6 at night to 6 in the morning.
Okay.
But I just want to clarify, so on the full-time too was the comparison and that stuff, so, because actually about 20,000 each, there's 3 people, right, on full-time?
So there's, well, if you include chief, there's
Yeah.
4.
Well, he has
Yeah.
he has a
But
separate
he has his own
line,
line,
right?
right,
Yep.
so 3
Yeah.
people on
Salary,
full-time, but part-time, the per diems are also in the union contract. It's only the call that are not part of the contract.
Yep.
Oh, good. The per diems are on there.
Yeah, I think that was important, given the fact that you only have 3 full-timers. You also want to have committed part-timers, per diems, that are well taken care of
Exactly.
and, encouraged to want to stay and see that there's room to grow in the organization as
Yep.
well.
Mhm.
All right, scroll down a little bit.
So this is kind of my operational budget that I have that shows here. And one of the things that I'm doing as I came in is I've broken the budget down, that I have a spreadsheet that I'm trying to track all of my expenses for specific, if you will, vehicle maintenance. I'm trying to break that down for EMS vehicles and fire vehicles. Same thing with my supplies, where it's kind of all lumped together and stuff. I'm looking at office supplies, if you will, supplies for the fire side of the house, if you will, for any of the tools and equipment we use, some of the gear we have. EMS supplies, kind of going down that same thing of looking at buying EMS equipment, replacement equipments and stuff like that.
Do you have a more detailed one you'd like me to go to?
No, I don't. I've just kind of created that. I'm tracking it this year, and I'm trying to put the money into the right pots type of thing and trying to break it out a little bit more. And to be honest with you, I think as I do this, it's going to look a lot different next year from what's broken down here. Because I think some of my professional technical services will actually break down into, that money will go down, because I'm going to move that into supplies. As I'm finding that these generic ones, there's a lot of different things that go underneath it that just don't make sense as I'm breaking it out. And one of the things I did is I increased repairs and maintenance, is kind of a broad stroke for, I'm kind of looking at that as my vehicle maintenance budget. And there's also some station maintenance that goes with that, and if you go down, vehicle supplies also has some supplies, and it does have, vehicle maintenance that goes into that as well, is what I'm finding. Because right now, I think I've expended almost $20,000 in vehicle repairs at the moment, which isn't anything, any catastrophic breaks. It's just tires, brakes, the services, the
Just normal.
preventative maintenances that we're doing on the engines. They're big trucks, so they are expensive. We do those based on engine hours and also on mileage on the truck. And to be honest with you, usually it's about once a year that we will probably do those on the vehicles.
Yep.
And they're probably about $1,000 to $1,500 per truck, depending on what's going on with it. And then we also have, pump certifications that go in for the truck, which the standards, by getting them certified every year, tested, we meet the standard for an FPA, which goes into ISO for the insurance ratings. Same thing with my aerial truck. There's an aerial service that goes with that. They get pretty expensive when you get into these big trucks, and as you know, everything's going up. So that was kind of where the increase came from, where I put in for the extra $1,277. I think I did that based on about my usage of what I've done so far this year, and kind of trying to break that out just to account for the right amount of money. I'm pretty sure I'm going to have to do a line item transfer just to meet some of those obligations that I have with those services that we're doing on the truck. The professional and technical services, that was an increase that came from, one of the things that I had to do this year was to get unfortunately another copier for the station, which I ended up doing with a company called Ricoh. They were the best one that was out there. But the photocopiers we had in the station and stuff, we tried to get them covered under the Xerox company, yeah, to have them covered. They were kind of servicing it, but they refused to do anything to fix them when they broke. And I had 2 of them that failed. And to be honest with you, it was much more cost effective to actually kind of do a rent program through Rico to bring one in that can do the printing and scanning and faxing for us as well too.
Okay.
One of the things that goes into our EMS operations is we have to be able to scan or upload any of our patient care reports to the hospitals within 24 hours of that incident taking place. So it allows the crew to be able to come back and actually fax that to the nurse or the doctor at the hospital. And if needed, they can also scan it to somebody as well. One of the things that we did this year as well too is we switched our scheduling program to a company called DTS, which is a company that the police department uses. They kind of had tested the waters, if you will, before we considered it.
Yep.
It works very well from a scheduling standpoint of being able to put people in. It tracks their hours very well, and the overtime, there's an approval situation that goes into it. And it was about $3,000 for that program, and so I kind of put that in as well. And that's where that increase kind of came from. The one that I did put in for vehicle supplies, the 2704, was just looking down the road with the vehicles, with picking up. One of the things that we're doing is the police chief is able to get a cruiser with some ARPA monies, and I'm going to take one of his cruisers that's a hybrid that we're going to be able to use at the fire department. And hopefully, right now you'll see the pickup truck is used quite a bit, that utility truck, which is a great truck to have for, if you will, fires and stuff like that, to bring hose back, get into the woods, that kind of stuff. From a standpoint of doing our inspections during the day, running the errands to pick up anything at Lowe's that we need for station maintenance and stuff, it's a big truck with a big motor to use for that, and I'm thinking the hybrid might be a better choice for us. So that $2,700 is kind of an estimate of what I'm going to need above and beyond what I have right now in July when I receive that car, to be able to get some lights to outfit it, and to actually put some decals on that car, because I don't want anybody to confuse it with a police car, because it is going to come to us as gray, and I'm probably not going to spend the money to have the car repainted, but I will have it lettered so that it's not, I just don't want anybody confusing it and wondering which vehicle it is. It tends to be bad for the police department if we do something and they get blamed for it. So those are kind of the explanation of my increases there and what is kind of broken down for the line items that I have right now. And as I said, I'm working on trying to improve those better, so it'll be a much bigger spreadsheet next year, but I'm trying to give a clearer picture of exactly what we're spending our money on, because I think this is very vague, and as I said, a lot of them are blended together right now, where the station maintenance, vehicle maintenance and stuff, and the station maintenance, the highway department does a lot for us, but a lot of the stuff on the inside for the station maintenance and stuff we do, and it comes out of our budget. And Fred will take care of stuff for us, but a lot of times I'll receive the bill on that because it's more of an inside thing as opposed to the outside.
Is capital planning aware that vehicles can be transferred over and not replaced?
Yes. Yep. Or at least
It happened at a select board meeting.
it did.
When we talked about the
But
ARPA
you
vehicle.
took it off the capital plan because you had 2
I did.
cruisers and
I
you
did, yeah,
you
yeah,
reduced
yeah,
by
I
one.
did
So yes,
too,
they
yeah.
are aware.
Okay. And this is the budget covering fire and EMS combined, right?
Correct, yes, yep. There's, like for the professional services, I think, I'm not sure what the total amount's gonna be, but I think we're up to about $5,000 that we're paying for our billing company right now to, to kind of handle that billing for us to bring in revenue for the transports. And all the equipment on the ambulance, all of the replacement stuff that goes with that kind of comes out of this operating budget.
So that's billing for, like, for insurance company payment
Yes.
on that kind of
Yep.
thing? Yeah. Yeah, we definitely want those
Yes.
revenues coming in, don't we? Yep.
So one of the things we'll have to sit down and talk about, and we haven't had a chance to talk yet, is obviously it's a significant increase on the payroll side. So we'll have to figure out, because given what we looked at with the contract, there was a hope that some of the overtime would, or some of those part-time shifts would go down as we were able to get a little bit more steady in the per diem shifts.
Yep.
So, you know, I understand you've still had a lot of shifts that have gone unfilled, and
Right.
my understanding is this would be your way of bringing things up if those shifts were filled.
Correct.
Because the way we covered the current year contract was you had a lot of unfilled shifts that was
Correct.
actually able to pick up that contractual difference.
Yeah,
So, because it is quite a jump, so we'll have
it
to
is.
see what we can do.
So since the new union contract went in effect July 1st, are you fine for salaries for this fiscal year that we're presently in?
Yes, I think this year we're gonna be good for salaries kind of going forward and stuff. If there's enough money in there that we're gonna cover that. And one of the reasons that factors into that is because of all of the open shifts that I've had. We haven't paid out any money to anybody. So one of the things I'm looking at as we move forward is kind of like a staffing study to see what it costs to fill those shifts. You know, and one of the things we do is with our part-time firefighters and stuff, they're eligible for some health insurance, they're eligible for leave time. It's prorated to the number of hours that they take per week. But kind of looking at that if I had 10, you know, employees that were taking small, if you will, sums to do that towards health insurance and leave time, if I apply that towards a full-time position, it may end up being the same cost. So if I took that money and moved it over to a full-time position, it gives me more guaranteed coverage, and it reduces the amount of, if you will, part-time firefighters that I have to do, and I can rely on the call firefighters to fill in the shifts if they're out on, you know, sick leave or vacation leave. So I'm playing with it to look to see what is going to be the best, if you will, bang for the dollar for the taxpayer moving forward, and kind of giving us the stability in staffing that we need as well. So if everything was to line up in the next year and a half, my hope would be that I might be able to move some of that salary money over from the, if you will, part-time wages into a full-time positions, and actually be able to reduce my reliance on the part-time firefighters and even reduce that line item a little bit as well.
How long is the contract for?
3 years.
3 years.
Yep.
And what did you say is, or didn't you say, is the percentage of increase each year? Do we know?
Yeah.
You're talking about, well, there's step increases, there's COLAs, and then there's incentives. So much like a police contract, it kind of varies depending on where you're at.
Or like a teacher contract?
Correct.
Yeah.
Yeah.
So I believe we did 2, 2, 3 on the COLA.
I believe so.
And then
And
the
then-
steps are an average of 2% between the steps.
Yep.
There were a small amount, I mean, it's pretty low on incentives, I'll be
Right.
honest. They
Yeah.
had, it was really a bare bones contract, so
Yep.
we're incrementally adding a few pieces in. We talked about, there was a small
Small
educational
educational.
incentive. I think it's, trying to remember off the top of my head, 50 cents, 75 cents, $1, depending on whether you have associate, bachelor, master's degree. So it's a little bit tough to say what exactly
Okay.
that increase is, but.
Okay.
So, for the simple-minded, like me, and if somebody asks me a question,
I find it that hard to.
so I'm looking, stop, Cliff. So I'm looking at that subtotal line on the personnel services, and so I pulled up my little handy calculator. I could have done this in my head. Scott's putting me to shame, but you got, you know, the change fiscal 24 to 25 is 72,000. So that's 10%. So can I assume that the increase this year, that what we're seeing there is because of the contract negotiations?
Yes.
What most of that change is, and that's the kind of simple answer I'd like to give people
Yes.
who might ask me.
Yeah, I
right?
think that's the simple answer, because I think when you get into the part-time wages and stuff, it's not as, I mean, it's a larger sum, but it actually goes to more people and stuff. But yeah, that is the
okay.
simple answer, is it's because of the union contract and stuff and the increase that was given.
And we, the town, liked doing that because it gets our people into market
Yes.
where they belong.
I
Their
will
comp.
say it was a morale booster for the department and stuff, because
I would hope so, yeah.
they came out of negotiations with the town in a very it was a very positive experience for them.
Yeah.
And I think it's fair to say that they felt appreciated in that.
Well, and it is rooted in like I said, the market analysis that we did of the area towns.
Yep.
And so,
Absolutely, yeah.
you know, it was definitely a sticker shock. I'm not gonna lie. When we went to the select board, it was like, oh my God, this is a lot. And I understand that, and it is a big jump, but my biggest concern is, do we want, you know, either to lose people or not to be able to even attract people to begin with? I believe the overnight shifts before we adjusted the contract were just shy of $16 an hour. You
Wow.
can make more at McDonald's.
Yes. Yep.
And we're asking people to
are they
literally
now?
run into a burning building.
Now they're, I believe, the starting for it, I believe it's
I can pull it up.
21, or, yeah, if you want to pull it up. I
That's
believe
good.
it's
Yeah, give me
21
a
or
second, I'm just
22
gonna
per
unplug
diem.
this
That's
for a
good.
second.
That's good.
But you know, this is a consistent story we've had in Berlin, sitting on FinCom for, I don't know, you know, 5 more years, is once we created that personnel committee here and started to look at comparables in the market, we kept finding these places in our with our employees that were just completely out of whack. And so we've slowly been bringing people where they ought to be. I don't know why fire took this long, but there you have it.
I think being the first contract, they came in and, to be honest, they were, I think they sold themselves a little short.
Got it.
I mean, I'll be honest, but I
Yeah.
think they were trying to be really fair
Yeah.
to the town.
Yep.
And so, of course, it's a bigger jump when you do just a little tiny jump on the first contract, and then you look and go, oh, okay, we're a little wiser now. Now we've looked around and seen what's out there. And, you know, also, you have to understand, too, they're looking at not just fire contracts, but they're also looking at what are police getting? What are other
Yeah.
public safety
Yeah.
professionals getting? So, give me just a minute and I'll pull that up. Because it is helpful to see.
Are you seeing other towns having to make bigger jumps in salaries to
Yeah,
keep people as well?
Yeah, I'm starting to see other departments are coming up a little bit quicker, trying to figure other ways to attract people. And quite, to be honest with you, I think right now there's probably more openings than there are people to actually take the full-time positions throughout the area. I know right now Lancaster's hiring people, and when I say hiring, they have a hiring process that they're trying to find people, and they haven't yet. Northborough is looking, Marlborough is looking, Southborough is looking. And I'm trying to think of some of the other departments I know that they've had multiple listings out there and stuff trying to get people. And it's, you know, the generation that's out there now is looking at the fact, well, I can jump to this department and make another $3 an hour. I'm going to do that, and if you want me back, you can raise it and I'll come back and stuff. Where I think my generation, when we came into the fire service, there was a lot, and I don't want to say that there's no loyalty there, but you looked at the long-term career and what that benefit was going to mean and what it meant to be there for 20 years. And we're not seeing that now, where people are looking for what's right in front of me, what can I make right now. And that's how they're making the decision. So they're jumping to the higher departments. At the part-time level with that per diem firefighter, that's where we see a lot of people jumping around based on, okay, well, if you're giving me $21 an hour, I can go over to Boxborough if they're going to pay me $23, or I can jump over to Princeton because they're going to give me $25 an hour. And that one's a little bit more fluid, where it's happening more quickly, where those ones are going up, and we're seeing that competitive of how do we get people to come in.
You know, there's a price to pay for stability.
Yep.
And unfortunately there is, and I think also you look at, and I keep saying this, which some people understand, some people really hate. We are in the 495 corridor. We may be physically, we may be county-wise located within Worcester County, but geographically we are in the Metro West area. And so we have to also look at what the surrounding cities and towns are. We have to look at Hudson, and I understand that Marlborough, Northborough, Westborough, definitely different towns, wealthier towns, bigger towns, but people who live in this area have the option to look at those other communities too. So we have to have a level of competitiveness to some extent, or we're just not going to get anybody. So I did break, this is a tracked changes version, so you can see what the old rates were. The nighttime per diem Sunday through Thursday was $15.83 an hour. You got $17.50 if you did Friday and Saturday.
Yeah.
And you can see kind of what the day, for some reason the day shifts paid more than the night
They
shifts,
did.
which I don't understand,
That's
because why would you
never-
work at night?
That's yeah.
I mean, who wants to do that?
Yeah.
So I think that was a big part of shifts going unfilled too.
Did
So-
they have more responsibilities if they were on a day shift?
There was a little bit more responsibility that went on with the day shift for, if you will, the truck checks that you had to do, the restocking. That tends to be when you're gonna go, if there's errands, when you transport someone to the hospital, you go pick up, whatever we needed for supplies, that type of thing. So there was a little bit more activity during the day that was going on.
So, and then if you look at also, like, your starting firefighter EMT was, this is for career, so your full-time personnel was $21.94. Your lieutenant was starting at $24.90. So you were looking between like 22 and 25 for your basic firefighter EMT, and 25 to 28 for a lieutenant and the fire marshal, which that position was actually changed into a lieutenant / fire prevention, who does the work of a fire marshal and lieutenant. So it's actually kind of more like a captain position, but without going through all of that component of it, I'll show you where it went to. Yeah, so we did 223 was what was negotiated on the COLA. I'm a big fan of 222 always, but I lost on the last year. Let's see, and so where we went to, sorry, this is jumping around on me. Let me go on the side here. So year one is the year that we're in right now for FY24. And I'm happy to send this out to you all so you can look at it a little bit more. So, and I do have the market analysis I can send you to. Where we landed was actually we should be more in the 25 to 27 range for your career firefighter EMT, all the way up to lieutenant prevention, operating like a captain / fire, or a captain level, is more on the 34 to 37 side. And your day per diems, day and night per diems came up, but what the union wanted to do was they wanted to simplify payroll, and they wanted to have one rate for per diems, which I think made a lot of sense. And then the calls have their own rate. They're not union, so they're on their own kind of schedule there.
Yes.
But, yeah.
You guys weekly paid or
Yes.
bi-weekly?
No, weekly.
Okay.
And I know by simplifying that to one pay rate and stuff, it made things a lot easier for finance, because it bounced around. It made it more difficult trying to track who was working what, what different pay rate we had. Yeah.
Good.
I actually was just looking to see if I put a percentage in here of where we were at. I did a summary memo back when we did this. Yep, so associates, you got an educational incentive of 50, 75, or $1 an hour. We addressed some of the holidays because they were having trouble getting people to work on holidays. Increased uniform allowance from $1,000 to $1,250 for career, and from $500 to $750. Uniforms have gone up substantially in cost. And hourly rates. So we were able to collect data. The comparable towns we were able to get data from were Lancaster, Bolton, Stowe, Boxborough, Harvard, Maynard, Rutland, and West Boylston.
Those are good choices.
So there were a few more I would have liked to have gotten that we weren't able to get data for. But we took an average of their lowest step for each position, and we used that number for step one. So we could have even gone higher, but we literally took the lowest step for there. And then each step goes up by 2%, and there's a $3 differential between the ranks for career and $2 for per diem.
It's a nice broad sample, Kristen.
We tried.
good.
I
That's
kept
good.
pushing
Yeah.
back. So it was actually the big jump hit us this year, but because we had so many unfilled shifts, we were actually able to carry that $41,472.
Got it.
So that's why we're seeing it hit in
Yeah.
FY25, because
Yeah.
now we're starting to get people coming back and new people coming on. So we're actually going to be able to fill those shifts.
Now the numbers really make sense.
Good.
Okay, good. That's why I wanted to bring that up, because I looked at that and went, that needs a little more explanation. So
Yeah.
And I'm sorry, I totally jumped in all over you.
No,
but
you're
does
good.
anybody have
You
any questions
provided-
on that?
That's perfect.
There you go.
Doesn't
No,
matter.
no, you're all on your own.
It doesn't matter who gives the information as
That's
long as
right.
someone knows what the information is.
Do you have anything on the capital plan that's?
I do have a couple of things that I brought up on the capital plan. I brought up replacing our gas meters with, I'll be honest with you, I'm not sure why we have so many gas emergencies in Berlin, but since I've gotten here, we've had 3 or 4 very significant ones. Actually, we've had a lot of significant things since I got here. But the gas meters, one of the things that I was doing was we were looking at upgrading those, because what happens is the sensors they use for those, they basically burn out over a period of time. And we contacted the company to get the new sensors in and stuff. And when I contacted them, they told me it was about $2,700. So I was like, oh, that's fantastic. We have 3 meters. I was like, that'll work out great. It was $2,700 just for 1 meter, and a brand new meter is about $3,000 to $3,200. So I'm replacing all the meters and putting one on every piece of apparatus, so it doesn't matter which one goes. They have a gas meter so they can deal with the emergency at hand. And when you do have the gas leak, you need multiple ones to kind of test the area and make sure everybody's safe. So I have that's on there. I have a gear replacement one that I put on that is just a continuation of what we have been doing, where each firefighter basically has 2 sets of gears with the carcinogens that we're exposed to when you fight a fire with one, or you do a car accident, or you need to wash the other set of gear. They need to have a second one, and they're only good for about 10 years. So what I've done is, by replacing the gear over every year, spending, I want to say it was $35,000. For 5 sets of replacement gear a year, everybody's gear just constantly gets replaced. So in that 10-year period, everybody's gear, their gear comes out to 10 years, they get another set, and we have a program set up so that it just works that way. And it just keeps it so that's on there. Oh yeah, hey, that's great. I have the rescue tool replacement program that I was doing, which I'm now at the bottom and stuff, just because that's the first one that I noticed. Our rescue tools are kind of sporadic on the trucks that we have right now. We have some old, what we call hydraulic ones, which are the hoses that go to the gas motors and stuff that we use for cutting. Those ones, I believe the primary one we have is no longer in business anymore. The company went out of business because of it's that old. And the ambulance, when we got the last ambulance in 2018, I think is when they bought that, they got an electric tool, the e-tools that are battery powered. The technology with battery powered has come to the point where my plan is I'd like to replace all of our rescue tool equipment, the cutters, the spreaders, what we call the rams that'll lift the dashboard, to switch them all to the e-tools, because they're very reliable, they're very stable now. Obviously, as you guys know, the batteries work very well on everything that we use, and it would eliminate the need for having the gas-powered units on the apparatus. The gear grid system, and that was actually supposed to be, I think, a year or 2 out. That is the gear lockers that they store the gear in, that sits in the apparatus bay, that if you've ever been in an apparatus bay, you'll see the helmets, the boots, and the coats all hanging. Those are starting to get old. Some of them are starting to deteriorate, and we need to get new ones. So I was kind of pushing that out a couple years to look at buying all new ones to put up on the walls for them. The gear washer and dryer, obviously we talked about the carcinogens that goes on the gear. Our washing machine that we have right now is an original one that came when the station was built. And I had a company come out just to kind of take a look and evaluate it, and they were like, well, you're lucky it's still running. They were like, because we've never seen one last 22 years as long as yours has. It might be one of the longest ones, but they were like, if it breaks tomorrow, we don't have a replacement. We probably don't have the parts for it. So I'm looking to replace that along with a dryer unit, because with the gear, you can't use like a tumble dryer. It's more of an air one that is a passive drying system, because the tumbler kind of degrades the material so it doesn't last as long. The EMS stair chair is a chair that we use on the ambulance, and the one that we have on the ambulance that we're actually getting rid of when the new one comes in has made it past its life expectancy. Basically, the company no longer, if anything happens with that stair chair, we're kind of out of compliance with it. And those ones, the 2 things that I'll say that are saving the firefighter injuries for back and shoulder issues are our power lift stretchers that we have, and it's the stair chair that has a track system on the back with these handles, and it's like one of those things, a simple design that somebody came up with that it was like, it's amazing how well it works. But when we bring a patient down a set of stairs and stuff, it really saves on, you're using the machine and the stairs with those tracks, and it safely brings them down. The old chairs we used to use, if anybody had ever been a patient in one of those chairs that we had to carry people on, it's very nerve-wracking. You're moving a lot, and it's very scary for the patient, but it also throws the weight off when you're carrying them, and that's where we had a lot of our injuries come from. So that's where that $5,000 is. That's for a new one. to replace the one we have. And then, as I said, the $18,000 was for the 6 gas meter devices that we were looking to put on the apparatus.
You mentioned 3 before. Was it, you said you were replacing 3?
I was looking at replacing 3, and one of the things I would like to do is where we have the 3 units that we have right now, we have them on the 2 engines and one of the ambulances. If the ambulance is tied up at a medical call and stuff, we don't have access to that. And when you do have a gas leak, it's not just one meter that you need to use, it's multiple ones in order to find out where the hazard zone actually starts. And then we find out where what I'll refer to as the explosion zone is, where you have to be in a full set of gear with water flowing to disperse the fumes. So because you need those multiple devices, having one on every piece of fire apparatus is kind of the industry standard. So no matter where you end up going, if you're coming back from a call, you have that gas meter, you're able to see whether or not there's carbon monoxide. Hydrogen sulfide is the other one that it monitors. It monitors the oxygen level. And I believe pentane is the actual gas that it measures because it's the closest one that'll cover propane, gasoline,
Yep.
and there's like 2 other gases that I can't think of off the top of my head, but that's what it measures, is basically that explosive level, so that we can actually figure out where the hazard zone is and make sure it's safe for people to be there, and then as we get closer, where we can be before we're in that explosion zone.
So that's going to cover methane, right?
Yes.
That's
yep.
the other one, yeah. And those are handheld devices?
Yes, they're probably a little bit bigger than a cell phone.
Yeah.
They're kind of thick. They also have they have some other stuff that comes with them because you can use them in a confined space. So like for a sewer hole or something like that, or if there's a crawl space in a
Yeah.
residence and stuff, you can put the hose down in there as opposed to going down with the entire unit.
Yeah.
I was just gonna say, on a different note, because you brought this to Capitol, you actually saved money by getting something for free, the tanks.
Yes,
Yes.
You should point that out because
Yes.
that's a huge savings. That was on an earlier spreadsheet.
Yeah, one of the things one of the other things that we do is we have to, our SCBA tanks that we wear to go into a burning building, we have to get those hydro tested every 5 years. The composite bottles that we use that are lightweight, they have a life expectancy of about 15 years. So when I came, I kind of asked for an inventory of what we had, just so that I could get a good idea of what we needed to do when we needed to do the testing. We found there were about 40 air bottles that actually went outside their 15 years. They were no longer any good. We couldn't use them. So to get these 40 new ones, it was about $70,000 is what it would have cost us. So that was one of my requests through Capital, was to do that. But I found out that Southborough was in a grant program with, I think it was Franklin and one other town. I can't remember which one it was now. But they got brand new air packs. And they went with a different manufacturer, and they were getting rid of all the ones they had, and they could not sell them because the grant didn't allow them to make money on it or anything, because I offered to actually buy them or do something. So they ended up giving me the 40 bottles, and I have those, and they probably have another 10 years left in them before so I can now
Wow.
create a capital plan to do that further down the road, which saved us that $70,000. So
That's good.
yeah, I did send a thank you note to Southborough to thank them and tell them there was a huge benefit to us, but
That's great.
yeah.
I'm good.
Any other questions? Okay.
Thank you.
Thank you.
Thank you.
Thank you very much.
you. You ready to go?
I'm ready to go. I got 3 of them.
All right, which
I
one?
noticed some, like,
Let's start with
do 10?
communication.
Oh, you wanna do communications?
Communications. That's a positive one.
You got it.
Let's start off on a good note. So originally, you'll see here for communications, Abby's wages through the study went up for my administrative assistant. So we did have an increase at $23.84 in her payroll. And if you scroll down, the Neshoba Valley Regional Dispatch, the new number is
180.
198, 184. So it's actually a $14,805 drop from our assessment last year. So when you keep on scrolling down, the total actually is, this year's budget's $12,421 less than last year.
We
So-
added a new town, and that helps
Yeah, we added
to
a new town,
offset.
Boxborough.
Oh,
Boston.
Neshoba got a new town?
Yeah.
Yeah.
Okay.
How's that work? Does the town, like, each town, like a certain percentage?
Every town pays equal share,
Equal share?
because
Okay.
we all have equal say.
That's good.
Because, we're in with Lunenburg. Lunenburg's 5 times the size of us, but we have the same say as Lunenburg. So-
Okay.
What line is that on? Where was?
Oh, Neshoba, up here.
Yeah, it's under communications.
NVRDD,
Yeah.
Neshoba Valley Regional Dispatch District. Is that
I
what the
think
last
I think
D
it's
stands
now
for?
Neshoba Valley Regional Emergency Communications Center.
Well, then we need
I think
to,
it's
I'm not gonna get,
NVRECC.
I already got
Whatever.
used to the
Alright.
NVRDD.
I know, I just got used to
Yeah.
that.
I think it's the NVRECC now.
It's a really interesting setup. I'm gonna just jump
Yeah.
on you for a minute. There's an administrative board that actually has the town administrators from all of the towns. There's a finance board that has either the finance directors or town accountants from all the towns, and an ops board that has fire chiefs and police chiefs on it. So it's a pretty robust process, and they're all, obviously Lunenburg's bigger, but they're all towns of similar nature and size in terms of, we're not talking, large cities or anything like that. So it seems to
Not
work
yet,
well.
not yet,
Oh, no, we're not gonna be talking
Not
large
yet.
cities. The admin board took a vote on that.
not yet, not yet.
So that's, we just kept it flat then, is what you did.
It's
It
12, it's
lowered.
actually negative 12,000, or 14,000. 12,000, negative 12,000 for the entire budget.
Because now it's
Oh,
198.
for the,
Yeah, it's
down
12,
at the
it's
bottom.
actually,
yeah.
it's actually negative 12,421.
Because Neshoba went down 14, so instead of being an increase of 2,000, it's a decrease of 12,000 overall for the whole budget.
So they do both
Oh,
fire
you
and
have to keep
police?
going.
Yes, yep.
I see, I see.
So the total department request will be 264,745. Any questions on
Which one do you want to go to next?
it? ACO?
Sure.
All right, so the ACO, this just shows our 2%, in other words, 2% increase. I did put in a supplemental funding request form for the ACO.
ACO is the animal control officer?
Yeah, and we're still way below area towns, but I put a request in for another 3624 to bring her up to 9,500 for her salary. When we sat in a regional planning committee meeting, the town administrator and we are still, comparable towns are paying 16 to 17,000 a year for their ACO. And this still puts us at
10.
95, like 11.5, 12 with expenses. So 35, about 11.5 with expenses.
So the level funded budget, if you will, is 8,456, and then you've asked for an additional 3,000.
$624.
624. So what would the total be?
So is that additional to add hours or just to increase salary?
Sounds like just a match.
Increased salary to retain.
Yep.
She's doing 5 towns right now, or 4?
Okay.
Yeah, 5 towns.
Right, so she agreed to take us on at the budgeted amount that we had already set up for FY '24, but there was an understanding that there would be a discussion for FY '25. So that's
Okay.
why this is
Yeah, so-
done
so-
as a supplemental.
Yeah, so it'll put us up to 12,078. Not a scare tactic. If she doesn't get it, she's leaving. And then we're gonna be without a ACO. So, it's not worth her time to come to Berlin for, the 5,600 a year when other communities are
Yeah.
paying 15 or 16,000.
Yeah, 3 times
So-
all that, yeah.
And how many hours is that?
Well,
working at that?
we don't require hours, we just require that she's on call. And with our ACO now, we have her and her husband. Her husband's also a licensed, certified animal control officer as well.
Mhm.
So we get the benefit of both worlds with having her. So she, as far as I know, has not missed a call, hasn't missed a monthly report. When we sat in our meetings, we were in a meeting with a community 3 times our size, and they had probably a quarter of the ACO calls, and I think they were, was West Boylston?
Is it West Boylston?
24,000?
Yeah, they said we have as many horses as people here in Berlin, so we have a lot more ACO calls.
Yeah, yeah, so yeah, it's just trying to get her up to par on it. And even it sounds like even if we go regional with an ACO, we're looking at probably a contribution of, what was it, 17 to 20
Yep.
on a regional ACO.
So
Right
it'd be
now,
right up there anyways.
yeah,
no matter what.
she has her own kennel. Community just built a kennel because they host their own ACO, and we were shocked to find out that kennel was $2 million to build
Holy shit.
for
Wow.
the community.
Wow.
Yeah, because they did not go regional, and they wanted their own kennel and their own ACO. It was $2 million just to build a facility for animal control.
So if we could get her with her own.
Where is
she-
this kennel?
I forgot what town it was. It was.
Is it Harvard, is it?
No, CMRPC.
Oh.
Yeah, okay.
No, it was up by Auburn. It was up by Auburn, somewhere in that area. I can't remember. He was talking about it.
Oh, okay.
In the meeting,
I
we
don't
were
remember.
talking to the community, built their own. They just helped build a kennel. It's $2 million.
The standards are extremely high. It's quite expensive to do. So the fact that she already has it, it's small, but it's meets the standards and.
Yeah, it's small, and she wanted to be make sure I budgeted for. So you see the contracted services $280. That's for a 7-night stay in a kennel. That's about the average yearly expense we should be looking at. It's about 7 nights stay in a kennel, and it's $40 a night. So I would take $280 over a $2 million bill.
Oh, God, yeah.
So,
Usually our pet animals are
Yeah, yeah.
found and
yeah, I
matched
think,
up pretty quickly.
The Worcester Animal Rescue League, I think is $50 a night.
I believe so.
I think it's their $50 a night. So if there's room.
Right.
But like I said, we're pretty fortunate to have her. And,
Plus mileage to Worcester.
Yeah, and she has the amenities, so, so that's the request for the ACO. Should bring it up to 12,780 total.
Going to the big one now?
Yeah,
And the police department.
I'm going the wrong way. No, I'm not going the wrong way. Yeah, I am. What am I doing?
So
You're
we're
in
looking for.
There we go. Okay, sorry.
You're in another planet.
I'm telling you.
Shane,
Alternate universe.
Shane, we're gonna be looking for you to ask all the questions now.
All right.
Yeah.
It's your new
It's
job.
all
Inside
right,
track.
so the budget I'm showing you, the only 2% increase is my salary. The full-time wages is level funded. Their contract expires June 30th. Did not add anything to their contract.
Right.
That is step raises. That's step raises for the officers going up. Part-time wages, you'll see I did knock down a bit. I transferred more money into full-time overtime. We, at one point, had 10 part-time officers, 9 actively working. We're now down to 8 and 4 actively working. We're running the same situation as fire. However, fire still does a firefighter 1-2 program. We only do one academy now, and it's 800 hours. Whether you want to work part-time or full-time, it's a $3,200 fee to get somebody into it. Plus, we're responsible for paying them while they're in there. Uniforms, equipment's probably about another $3,000 per person. So the states, through police reform, is doing a good job of getting rid of part-time police in Massachusetts. So
So how much, and you're adding that, how much is the cost, it's going through the academy approximately? What you threw
So
out there?
payroll equipment is about $45,000 to get them through the academy. And
Okay.
And that's fully sworn,
that's
everything?
Okay,
It's about
45.
$45,000 for the 24 weeks, and then it's 12 weeks of field training. So it's another say 14 to 15,000 in field training.
Yeah, it's not.
So you're looking
yeah.
at around 60K?
Yeah. I
Okay.
mean, your first 60K is just like the officers, the student officers we have right now, They started November 21st. They started with us. The 27th, or 20th, and the 27th they started the academy. They get out May 3rd. They'll probably be on their own in August. So, it's a lot to swallow. We have 2 in there right now.
The reason I asked though is at the select board meeting Monday night, the number that was being thrown around was 100,000.
Yeah, it's going to be. You might as well say their first year because remember that's 60,000 plus health benefits, plus they're using the cruiser, wear and tear, mileage, fuel. It's probably pretty close to 100 grand.
Overtime covering the overtime.
Yeah. Never mind the overtime that we've been paying for officers to cover shifts where we're short-staffed.
You guys 12 hours too, or what do you?
No, 8 hours.
8?
4 on, 2 off.
Okay.
So we actually work a 37.5-hour work week on average. You'll see, I turned back a lot of money in part-time wages last year just because we didn't fill the shifts. And rather than, do line item transfers, for next year, I just automatically put the money over to the other side into overtime, make sure we can cover costs. Hopefully, fingers crossed, cover costs. Then contracted services. This mostly went up for $5,100 of that went up. Where am I right here? 5,100. Lexipol. That's our software. Part of my contract was to have the department accredited by the time my current contract expires. With that comes significant costs. The first one is our policy and procedure manual. Lexipol is actually helping us with our policy and procedures. So it's basically like outside contracting a person because obviously when we're running a 60% staff, we don't have time to run policy procedures and answer calls. So they stepped in at a severe discounted rate to help us out. So basically we're paying them as an outside service so we can help our staff still work and answer calls. But with accreditation, we're going to jump up because there's more work involved in policy procedures. We're going to probably jump up to about $12,000 a year just for policy and procedures manual. Never mind everything else we need to do within the station to get us up to accreditation standards, which is redoing our armory, redoing our evidence room, which we're working on getting costs, and it's not looking pretty right now.
Is that through the state, the certification?
Yeah, that's only state. That's
State?
not federal. That's a state certification.
So
I think we're
that's
gonna-
something still coming? Are you talking in the contracted services line here?
Yeah. So contracts are. That's why it jumped up because most of that's Lexipol. That's our policy procedure manual. Yeah.
I think that we're going to need to modify our approach a bit to accreditation, to be honest. I have a bit of a different take on it. Most small towns are not doing it because of the cost, and it's not required by the state at this point. They are targeting, I believe, 2027. So obviously you want to work toward it and do the policy and procedure side of things that you can work on. But some of the outfitting that you have to do to like the evidence room and other issues, there's a lot of pushback right now at the state level coming from these communities going, where's the money to do this? So I would hate for us to sink tens of thousands of dollars into this and then the state to change it because they're getting this pushback of where's the money going to come from.
Right.
I think accreditation is great, and I think implementing policies and procedures and processes that work toward improvements and modifications and modernizations rather of the department are there, but I would be hesitant to rush and spend a lot of money just to meet a contract term. That's just my take on it.
Yeah, that's one reason I haven't put on capital planning yet because it's not that we are rushing. We're definitely not the first. We're not going to be the last to do it. But we have to do it, especially if we ever do expand to the second floor. Our evidence room's going to move up to the second floor. I don't want to spend taxpayer money to do over our current evidence room, only for the then architect engineer to say, "Oh, that won't fit upstairs." Even if it happens 6 years down the road. I want to make sure that whatever we do can be moved along with the room and fit into another room and not custom fit for the room that we have. 23 years ago, we were fortunate. That was back in the day where there was 5 or 6 of us full-time and like 12 part-time, and half the part-timers were carpenters. And, one in particular built our evidence room for us and saved the town probably 23 years ago, probably $20,000, which would probably be $60,000 today, which was fantastic, but it doesn't meet, obviously, the standards of the state now.
Just different times.
Yeah, so like I said, I haven't put any of that on the capital planning because I just don't know. It's gonna be a big expense, a continual expense. And, I mean, just our armory, we're looking at a $2,500 gun locker for our armory. Even though the armory's locked, 3 people have the key. Then when you get into the locker room, you have to have another lock cabinet where your guns are gonna be.
This is
So,
what I mean, some of this stuff just
It's
doesn't make
Massachusetts.
sense.
Yeah. Yeah, all right. So, gas I kept the same. Obviously, we have a fleet of hybrids now, or we're running 4 hybrid cruisers, so our fuel has gone down slightly. I didn't change the price per gallon. I still left it at $3.25, even though it's a little cheaper at the pumps right now. Obviously, everything going on worldwide now, but especially with shipping. Like, I don't want to, come back next year and say, hey, I need, another $6,000 because gas went up to $5 a gallon. I'd rather that. Vehicle maintenance, I've tracked my vehicle maintenance over the last couple of years. We're really up in the $8,500 range. We were budgeted $8,100. Set of brakes now $750. The Crown Vics was $250. Now it's $750 for, especially with the hybrids, because they come with different brakes on them. So that's just brakes. Tires are now $166 a piece. When I first started, we were getting good years for $25 a piece. But yes, no comments from Kristen on that one.
Where's the vehicle maintenance at? Is that
Thank
under
you.
Oh,
other?
sorry. Oh, I'm sorry. I'm looking at mine.
Oh, okay. Is
Yeah,
that in other?
this right here is like the short version of the other
Yeah.
sheet.
Yeah,
Do you have that sheet in here? Or did you
Should
hand that
be.
sheet in? Because I
Yeah.
can, yep.
Yeah.
Oh,
sure.
there we go. Nope, not that one. Might have to turn it around.
Yeah, there it is.
Hold on.
You want to flip the screen?
Nope, no need. Give me 1 second.
Download and rotate.
That's right.
Mike, can you hold that for me?
Let's not get crazy. That was an expensive television. There we go. Make it so you can actually like read it. Oh,
Really helps down that screen. Thank you.
good. Oh, I'm glad. All right, no. Okay. Which line were you looking at, or do you want to go back?
No, that's fine. I was
Vehicle
down to
Vehicle maintenance.
vehicle maintenance.
Got it. Okay.
Uniforms are the same, because obviously the contract's the same. Radio repair and batteries, I went up $400, only because after looking at last year, all the prices have gone up. So that's probably gonna put us right on target, right around the $3,900 mark for that. I am happy to say we are waiting for the final approval for a $400,000 grant from the federal government to upgrade our radios on top of the, what do we have, 288 or 300,000? We have 300,000 right now. Fortunately, most of our radios issues are coming out of a private donation and a federal grant. Fingers crossed. That I really don't want to put that on the taxpayers.
And the nice thing is it is federal,
It's
so it would
federal.
not be subject to the Healy cuts that came out over the weekend.
Yes.
Oh.
Yes. Yeah. What else do we get? Oh, bullet resistant vests next year. I have a lot of officers that vests are expiring. So I actually had to go up. I think I actually have 6 officers expiring next year. I budgeted for 4, not knowing. I think, whether or not somebody still wears theirs or is going to get another one is something to be decided. But most of that stuff comes back on. We go for reimbursement on the bulletproof vest, which comes back to the town. So that's basically just front and grant money, and then it comes back. Ammunition I kept the same. Tasers and chargers, the batteries and cartridges. I do have 3,200 on there, but I do have a capital expense to get brand new tasers. Our current tasers, as of June 30th, are being sunsetted. They're no longer going to be insured by Axon. So they're pulling them off the market, basically. So it's forcing communities to get new tasers. When we got the tasers 5 years ago, we got the old model to begin with. So this was kind of, I guess, to be expected. Caught me by surprise. But this is apparently how these companies make their money. So the new program is $25,000, and they give us the cartridges and the batteries. They're rechargeable, so we don't have to buy batteries anymore. So basically, right now we're spending $3,200 a year on 5-year-old tasers just for cartridges and batteries. The new ones we have to pay what, $4,000 a year for 5 years to meet it. So we go up $800, and we don't have to buy tasers or batteries or cartridges anymore. They'll supply all training cartridges and any cartridges that we need to replenish their stock. I did put back in full-time specialized training. Last year I cut it down to 25. I cut it in half, only because Municipal Police Training Council was putting on all these wonderful classes. Once again, another Healy Driscoll cut was $3 million from the Municipal Police Training Council. They shut all the classes off. So now we're going back to funding our own classes again. We enjoyed the ride while we had it. Even though the Municipal Police Training Council has a special legislation article where they get, I think, $2 for every rental car rented in Massachusetts. That money that they were getting wasn't taken away. They're still getting that, but they took $3 million away on the other end. So be it. So yeah, all our specialized great training went by the wayside, and so I did put it back in the budget. I'm hoping that it does get funded again, but I can't take that risk again. It's kind of been a blah year, not be able to send people to the specialized training they need.
You said it was in there like half that amount before?
Yeah. Last year I had 2,500.
Okay.
And I put it back up to 5,000 this year.
Okay.
Or this
But you were still able to get the full benefit at the time?
No.
Or was it only?
No, I shortfall, big shortfall. I was banking on the Municipal Police Training Council
Right.
on all these great classes again, and unfortunately they cut all the they cut the FBI LEADA classes, the Dean Crisp classes that he had on. Cut all these classes that everybody would go and come back and be absolutely excited about their job for the next 6 months. They cut all those classes. So, but I can send them all on human trafficking classes if they want. They can go for the next 3 months to human trafficking classes, which doesn't benefit Berlin at
Big
all.
problem, yeah.
So, yeah. But I guess that's where the feds are putting their money into this year. So. But yeah, I kept everything else. Police Academy, I kept it at the 3,000. New recruit uniforms, 2,500. It's kind of an under budget, but I'm hoping not even have to use that. But I need to keep that in there, just based like the fire chief was saying earlier. People come and go. We lost 2 officers last year. One went next door for a $9,000 raise, and one went 2 towns south for a $12,000 raise. Which obviously we need to, basically it's educational incentives. It's not, their pay's the same, it's just so we don't offer the educational incentives that other communities do. And both of them had their bachelor's degree, and they jumped on the money wagon.
So we don't have anything like the fire department where it's like
we do, but it's limited. You don't get anything to year 2, and you get a little piece of the pie year 2, and then year 3 you get a little bit more. Year 4 you get a little bit more. Year 5 you get your money.
Right.
And we just not, people aren't here, and they're not going to wait 3 years for $10,000.
Yeah.
They want their $10,000 today.
And I don't think the state's going to start funding Quinville
No.
anytime soon.
No, and I think one of the things, I had the opportunity to speak with the governor as well as Kristen and Chief McQuillan a few months ago. And, one of the biggest flaws of the Quinn bill is that it's for criminal justice degrees. Well, if you want us to be if you want us to hire members of our community,
Yeah.
I want to have psychologists.
Yeah.
I want to have social workers. I don't care if it's a nurse, like I want to be able to hire anybody with a degree. I don't care what degrees in finance, whatever, IT.
Yeah.
I mean, it could be cybercrime, it could be anything, but we should be paying these people to come in to be like our community. You know, criminal justice is great. But when you want to be diverse and look like your community, you have to be able to hire people like your community. And, you know, if you walked in and said, hey, I got my doctorate in psychology, hey, nothing I can do for you, you know, here's your $68,000 a year, you know, have a nice day. You know, it gets a little, yeah, it's definitely a little restrictive. I mean, 30 years ago when I started, it was the path, you know. You know, somebody went for finance, what do you want to be here for, you know? Like,
Yeah.
we're not going to pay you, you know, you're not a cop, you know, you're a finance person. But, you know, we need, as you know, with crimes today, we need financial people, with mental health crises,
It's all
we
over
need
the-
social workers, you know. I mean, I'll even hire teachers, you know.
So is the framework of the Quinn bills, I mean, I know the big thing was when the state just stopped funding their half of the share.
Yeah.
So the Quinn bill still exists and the town still is under,
So the contractually, there we have 2 left under the original Quinn bill. Everybody else is under the educational incentive, which is a stipend, not included in their pay. So when I was under the Quinn bill, I got 25% for having my master's degree. So if I made $100,000, I got $125,000. But I not only got $125,000, my overtime was based on the Quinn, my court time was based on the Quinn, my sick time was based on the Quinn. Like everything went up with the Quinn bill, and we were being paid for it.
and that 25% was
Yeah.
split between the towns.
Town, 12.5.
Or,
and 12.5.
right, state,
Yeah.
12.5, and the town.
Yeah, and, you know, right now, we give us a flat stipend. I think it went up to like 10,000 a year. And, you know, they get paid, you know, every week, you get $250 a week, and that's it. There's no holiday incentive, sick pay incentive. You know, I personally, like, I never used the sick day. I've taken 5 sick days in 29 years. You know, I mean, you took advantage of that stuff, you know? I mean, I should say for our generation, it was a big boost, you know? You didn't, you know, you got paid for your holidays, you didn't take comp time, you know, you took your pay. And, you know, it definitely changed the mindset of, you know, when people say they want to make more money, you make more money, just do X, Y, and Z, and it doesn't affect your life, you know? But unfortunately, that was, the funding went away, I think, in 2006.
For the Quinn bill?
Yeah, 2006. The Quinn bill's still in the books, it's just,
Right.
but it does need to be modified, you know, it just can't be criminal justice, you know.
Can't we push that on our state rep?
We stopped. I mean, I talked to the governor directly about it, talked to our state reps about it, you know, state senator, state rep, they're on board. You know, it's just trying to get other people on board as well. You know, so.
Yeah, the problem we're facing is there are communities that are still funding at Quinn bill levels.
Yeah.
So that's where your competitive issue comes in on the police side.
So it's like the 9,000 and 12,000, those towns that are funding that?
Yeah. Yeah, so, you know, a few years ago, a lot of towns gave up civil service status. And with that, they brought back the Quinn bill, full Quinn bill for all officers, and that's how we lose officers. Because before, you used to have to be a resident of Marlboro to go to work in Marlboro. Now you just go take their test, take their physical, and they'll hire you on the spot. Yeah.
With
So-
all the incentives that they
Yeah,
offer.
yeah, with all the incentives.
So there's civil service, Marlboro?
No, everybody came out, most everybody came out.
Everyone's getting out of
Framingham
civil
came out,
service.
Marlboro came out, Hudson came out.
Leicester came out.
Lester.
Us too,
Everybody's
right,
out.
I'm assuming?
Yeah, we were never part of it.
Yeah.
We got to hire we got to hire the people we wanted to hire, not who we
Yeah.
were told, because they did well on the test. So
Good.
we were able to
Exactly.
hire for fit for the community versus
Good.
the state coming down. And,
So much better. I'll
Okay.
tell you, having been in a civil service community, not only is it an archaic system with an absurd amount of paperwork that's grossly underfunded at the state level, so you can never talk to someone to get things done, but what you end up getting is only new recruits. You never have people on that list that have experience. So you have a vacancy. Okay, well that's a year before I can fill something, and they usually get scooped up by somebody else or the state police in the process. So you have to literally just keep doing it over and over and over again. It's
yeah, and
awful.
they used to do laterals. They used to take laterals, but in order to do a lateral, like the Berlin Civil Service and Clinton was civil service, and an officer would go to Clinton and say, I want to go lateral, then Clinton would have to call Berlin and say, are you willing to release that officer?
Right.
And 99.9% of the time, the chief said no.
Right.
You know, and so there was never any, that whole lateral thing was a joke within the civil service industry. But yeah, so yeah, basically in a nutshell, yeah, the expenses went up $9,980, and $5,100 of that is just in Lexipol, which is our for our contracts. I mean our policy and procedures.
Want to talk about your supplementals?
So supplemental, as I said, that as we are running the same issue as the fire service, where we can't get part-time people, we need to start looking at transitioning over to full-time employees to fill the shifts and fill the vacancies that we're seeing. So I am requesting another officer, another full-time officer, which would be number 11. My plan is by 2027 to be up to 12.
Okay.
To complement, because like I said, there's no relief in sight. One of my part-time officers that works probably 1,200 hours a year is in the process of taking a full-time job with a campus police department. So now I'm looking at, and he's basically on our way we do our list, he gets the last dibs of shifts. So, which is going to create 1,200 hours more of overtime. You know, at our average is what, $63 an hour for overtime. I think our department average is.
Mm-hmm.
So, I mean, just that alone's, you know, $63,000 just to fill that. So, like I said, I don't see, you know, that happens. I'm down to 3 part-timers, backfilling vacation, training, sick, personal time for 10 people.
So this is in additional to the amount of full and part-time hours that you have? Or-
Yeah,
Okay.
yeah.
Okay.
So
Just to be clear.
if we want to go to the,
So you have 2 in the academy right now, you said that,
the Trinity
right?
Academy right now that are funded.
Okay.
Those are already in the.
Those are already included,
Yeah,
so,
yeah,
okay, so
yeah, they're in
separate.
the budget.
Okay.
But if we go to the part-time wages, right, see, you see overtime, I jumped it up to 87. Basically, I took away 17,000 out of part-time, and I put 15,000 into, back into overtime.
Can you also clarify the other half year
Oh,
that
yeah,
we funded
yeah.
last year that we have to fund the rest of this year?
So this right here, last year I asked for a half a year, and so this coming year, we're gonna pull up the difference for that officer. That's number 10. With the way our schedule works, 4 on, 2 off, if I get to 12, that will put us at 3, basically per rotation. So if one person takes a vacation, then there's at least 2 working. I mean, right now, we're running at the point where, you know, we haven't done any force-ins, but we have 1 person working. You know, I'm sleeping with my phone next to my head, my radio next to my bed. Same with a couple of sergeants, they're doing the same thing, just in case they need us. So that'll put us up to 10 full-time officers, or 7 patrol officers, 3 sergeants. And,
It's PT is patrolman. I saw it as
yeah.
part-time at first.
Yeah, no. I mean, politically, it shouldn't be patrol, it should be PO. These sheets are old, but that would put us up to 11. I'm gonna, in contract negotiations, I'm gonna ask for a swing shift. Right now, all the shifts are contractual, but I'm gonna ask for a 6 p.m. to 2 a.m. so that third person can be on 6 p.m. to 2 a.m. That way, if somebody bangs out on the midnight shift and there's only 1 on, at least we have 2 people on until 2 a.m. And then at 7 a.m. we go back up to full staff again. Where if something happens between 11 p.m. and 2 a.m., that 6 p.m. to 2 a.m. can stay on, and assist. So I'm just trying to be creative in putting people in places where we don't have to backfill as many shifts. So a lot of money will come out of the part-time wages. But like I said, we ran this budget with 10 part-timers. Now we're going to be down to 3. So that's a lot of hours for part-timers to be working.
Is it worth investing more part-timers or just your full-time?
There's no academies for part-timers other than full-time academy. And why would you work part-time if you go through a full-time again.
Exactly.
You know,
Wow.
so.
I think you also probably find people are, I don't know if you find the same, that's actually a good question. Do you find people are more invested when they're full-time as opposed to
Oh,
part-time?
absolutely. Well, if they're part-time, want to be full-time, they're really invested because they really want to show themselves. But, you know, you'll see where I took away from like in-service training for part-timers. I brought down the hours. Fortunately, they do work a lot of shifts, and I do allow them to do in-service training online. So as part of their shifts, they can do their in-service, watch 2 hours of videos, and they can get their in-service done that way. So, just by doing that, we save almost $5,000. I have full-time officers that have opted to do in-service training online, while on shift. So that, like I said, we were saving almost $10,000 just in our in-service training alone. But I allow them to do it part-time. That's as long as the academy, they have let us do it this year, and there's talks about letting us do it again next year. So as long as they allow us to do it online, there's no reason why officers can't come in and do in-service training and work at the same time. Vacation coverage, I cut down a little bit because obviously we're not covering all these shifts. But I mean, when you look at the number of hours that we have for part-timers, now we're going to be down to 3. Divide that by 3, and that's like almost another full-time job for them. So, this is not going to happen. I'm more than likely going to be in for line item transfer from this budget into my full-time budget. But this is best case scenario. So.
But that reduction of 17 grand helps you to offset the
Offsets the cost of
second half
Yeah.
of that new officer that we
Yeah.
added last year.
Yeah, last year. And like I said, once we get into this next year is going to be challenging. But once we get into it, I'm going to be able to get the numbers even tighter. I think I'm going to even be able to go down probably another $25,000 to $26,000 in part-time budget to put over to full-time side.
That's good.
Yeah. So, like I said, we're picking up the extra 37,000.
Yep.
But remember, this is no 2% raise. They don't have a contract. So whatever the town negotiates with them, it's going to go up. But this is what I came up for
I have a
numbers.
plan for that, but it's negotiation, so I don't want to share too much about the plan.
Yeah.
Probably a good idea.
Yeah.
When did you say their contract is up, or is it up?
June
June
30.
30.
June 30.
All right.
Yeah.
I'm waiting for my letter from the union that should hopefully arrive any day now.
So when do you plan to have that negotiated?
I've asked, and I've been told the letter will be forthcoming. The union has to send a letter. That's how it starts according to the contract. So I've actually gone ahead and asked, and there's some elections and things, I guess, that are going on, and as soon as that's settled, they'll be sending over a letter to start negotiations.
Yeah, so I mean, that's the budget in a nutshell.
Thank you.
Yeah, and like I said, my supplemental request to go to number 11, I mean, obviously I have officers getting burnt out. I mean,
I can't imagine.
We've got officers that are here 80 hours a week, 72 hours a week. It's not I don't want to burn them out and then go into the crisis mode of having to hire, having them leave and rehire.
Yeah, a lot goes into
I
it.
just don't want it to become a revolving door, just burning people out.
I don't know
Is that
if you
something
kind of
we-
mentioned your capital, but I figured I'd pull it up too.
Oh, yeah,
just in
so
case.
the capital, we're due for 2 cars replacements this year, only because of COVID, we got 2 cars within like 4 months of each other. So same model year, it was the whole debacle. But like Chief McQuillan said, that the select board was kind enough to give us ARPA funds to purchase one of the cars with ARPA money, and the fire department's gonna get that car. That car that I purchased through ARPA money is $7,500 cheaper than the car I had to request for next year. Because we're a green community, we buy green cars. Ford went up $7,500 between '23 and '24. They went up $10,000 on the pickup trucks, on the electric pickup trucks. So I'm gonna come out and say we're getting gaffed. Because we're being forced to channel our money this way, you know, the suppliers are going, oh, great, boom, price goes up. So this cost of this car, $59,500, is taking all the equipment out of car 4 and putting it into the new car. This is not buying any new equipment, this is transferring equipment. The dealership told me if I'm buying a new car with new, and they changed the model style, we're looking at $72,000 to $87,000 for new cruisers now. That's what most communities are budgeting, between $72,000 and $87,000 for new cars. So fortunately with the ARPA money, I'm doing the other car for $52,000.
And that's a
but
23, right?
That's a 23, it's a
You're able to
leftover.
grab a-
Yeah, it was leftover
For a
23
leftover.
that I was able to get. And this will be a 24, as long as Ford doesn't cancel the order. We'll get a 24.
Which they did last year to up the price, right?
Which they did the last year, and it cost us $4,000 more.
Yeah, and you pointed out that because of the green community, Ford is the only one that makes the
Ford-
suitable hybrid,
No,
right?
Well, we can't say that.
Oh.
Ford is the only one that the Department of Energy, when you look at their small platform, medium platform, large platform, they're the only manufacturer that falls into their specs. Every other you know, make and model has them, but they're a mile or two off in MPGs. Ford says we get 24 miles per gallon on these hybrid cruisers. We're getting 17. There's no fact checking. You know.
But there may be a monopoly.
Oh, God, yes.
So it's sort of like, you know, the cruiser that I bought for the administrative vehicle was $40,000 last year, is now $52,000. You know, so, I
Disgusting.
mean, yeah,
And
it's,
that's why sometimes you have to look at other options, because price
Yeah.
does have to be a factor in all
Oh,
of
God,
this.
yes.
yeah, I mean, you
You're
know,
talking-
obviously there's a fiduciary responsibility to not just go out and spend taxpayer money and try to find deals where you can.
Yeah.
But, yeah, I mean, the first cruiser I picked up was $9,000, so that shows how long I've been on the job.
I was gonna say, you've been on the job a while.
Yeah.
For the supplemental, would we approve that, or is that more of a select board? That's been-
No, that ultimately comes through. So the way that this process works is I put everybody's request in.
Yep.
And there's a column for the supplemental requests.
Yeah.
I make my recommendation on what should be funded.
Yeah.
The select board will take votes, and they kind of do it in pieces usually.
Yep.
And then it comes to FinCom, and usually you like to see, if we're going as we've done it last year, you like to see the select board's recommendation before you take a final vote here.
Yeah, because the thing is, we've been asking more or less over the last few years for the equivalent. What do you need to have the same services and coverage that you had last year?
Right.
And then the supplemental is anything outside of that that's
Correct.
coming up.
And that's why we do it on a separate form, so,
Yep.
you know, you can almost, if it comes down to it, you can put the supplementals all together in one pile and go through and rate and rank, and see what you have when you look at keeping everything level plus a 2% cost of living and keeping expenses level, and then adding in your new growth and your 2.5% and seeing where everything kind of shakes out after that and what your priorities are. It's a little easier if you pull it out that way.
Yeah, and just remember, like, my part-time budget will go down when my full-time budget
Yeah.
goes up.
Yeah, offsets, yeah.
They're
Yeah.
gonna start to off.
Oh, makes sense.
You know,
Yeah.
I mean, honestly, by 2027, I see a part-time budget of probably $40,000 a year. You know, I mean, we made up over 150 at one point for part-time budget. You know, we're starting to drop that down and get the staff here, you know. Yeah, the staffing is the most important thing, you know.
Yep.
Yeah.
You know, I mean, we're not willing, I mean, you know, Mike and I have talked about this, you know, last week. You know, we were fortunate, we had 2 incidents, and we're fully staffed both sides. You know, one of them was an overdose, saved a life. The other one was a house fire, saved the house. You know, because we're fully staffed.
Yep.
Had that been a day before, a day later, you know,
Different outcome.
with that overdose, we're probably within 30 seconds to a minute of losing that person without Narcan.
Wow.
Our response could have been 3 or 4 minutes had we
Yeah.
not been at full complement that day.
Yep.
We lucked out that day. Fire department lucked out. You know, so, you know, I mean, yeah, like we said, it was like, this is incredible. Like, you know, this just goes to show. I mean, like, because I like to tell people, 6 years ago, we would have lost the house, we would have lost a life. you know, without a doubt, we were lost a house and lost a life because we weren't staffed at where we are today.
Yeah.
You know, but,
I remember when I was a trooper in Maine, we were down. It's just hard. It's not fair.
yeah, yeah.
I was just bringing this up and then I realized something got a little wonky, but just because you were asking, so this is kind of what it ends up looking like for you newbies over here.
Yeah.
I'm now an old seasoned professional after one round of this, right?
I've only dealt with school budgets.
Oh, okay. So this is your expense detail is what you'll see. And so you've got your FY24, what was approved at ATM, which is annual town meeting.
Yep.
Then your FY25 request column is going to be what the department heads request.
Yep.
And then your percent and dollar change was going to be the request versus what was actually approved last year. So you can see where you're asking for increases.
Okay.
And then the supplemental, as you can see, it's italicized, so that gets its own line there.
Okay.
And then I do a column with a TA recommendation that has a dollar change and a percent change over FY24. And then you can, as you keep going, which we haven't done this part yet, but so select board will take votes and we put the date in. I don't know why that did that. Oh, I know I did that. Then the FinCom will take their votes and the final one will go to the annual town meeting as the proposed FY25 budget. So it's a process, but we're getting into it. So.
Okay.
And then just in case anybody else is interested, then what we do is I'm starting to build the revenue sheet. So we look at what our revenues are, which right now this is full of assumptions. We don't even actually get the state aid numbers until the MMA annual conference, which is not for another 2 weeks. So that's where we'll start to get estimates on that. But I have put in what I think are reasonable local receipt estimates. And as you can see, they have gone up pretty substantially over FY24. We're really trending strongly in motor vehicle excise, and we are trending strongly in meals tax. One thing that's an anomaly that I'll point out right away, because I know Mary's going to ask about this. See how hotel tax went? We estimated $240,000 for FY24 for hotel tax because it came in at $250 in FY22. So we figured we were quite safe doing this, and I'll show you. So where are we here? So hotel tax, here we go. So whoops.
That's nice.
Oh, that's nice too. That goes along with Little John.
Yeah.
So our hotel tax actually came in at $263 in FY22 actuals. So when you build a budget, you're actually looking at 2 years back on your actuals because you're in the current fiscal year.
Right.
You have the numbers closed out from the previous fiscal year, and you're building the next year's budget. So basically now we're building FY25 budget based on FY23 actuals.
Okay.
It's a little weird, but so meals tax, we thought, wow. I mean, hotel tax, we thought we got $263 in FY22. This is great. So we'll budget $240. We should be safe there, right? Not so much. FY23 comes in and it goes down to $221. So we go, why? Well, number of reasons. There is a flux with hotels in terms of their rates because they have to be competitive. They often run deals, and apparently the hotel was running long-term deal rates. And this is where life all ties together. You may have heard about a little issue we're having at the state level regarding housing and people being housed in hotels. So although we currently don't have any families housed in Berlin, they are housed in many of the hotels in Marlborough. So the hotel we have here in Berlin was offering rates for groups that were coming for sporting events at New England Sports Complex and other tourist attractions in Marlborough because they couldn't get hotels in Marlborough. So they were offering them special rates to draw them to the hotel in Berlin. So they actually said, believe it or not, a $40,000 flux from year to year in hotel tax is not unreasonable, because we said, what is going on? Are you guys like giving away rooms for free all of a sudden? So the good news is, because we were up much higher than we anticipated in motor vehicle excise, we estimated $600,000 in FY24, and we actually came in at $708,000 in FY23, which makes me feel confident in estimating $675 for FY25 because there has definitely been an increase there. So anyhow, this is kind of how we do revenue for local receipts. So there's a pretty good increase in local receipts. I will tell you, state aid, we don't get a lot of our money from state aid. It's less than $300,000. I wouldn't be surprised if it's right around 280 or maybe a couple grand less. The state has a huge budget deficit, not only for FY24, but upcoming for FY25. So I wouldn't think we'd pick up very much there. We might lose a little bit. Offset receipts are your transfer station receipts, which we're still in the process of determining, kind of based on where we're at a mid-year point. We're still closing out December, so we don't have all of that information yet. Then you throw in your ambulance receipts. There's a portion of those that get factored into the budget, and cemetery proceeds as well from burials. And then you look at any assessor's overlay surplus, which we haven't put in for a while, and that one's a little, I'll skip over that one for now because that one takes a little time to explain. But also we have free cash that we put in for capital for BMS and Tohoto. That goes into the operating budget, not into the capital plan. That's just the way that it's been set up here over the years. That's kind of a unique thing here. We have an affordable housing account that we take $7,000 out a year to fund a consultant who assists us with all of our affordable housing needs in the community. And then we have our lovely mitigation money. We have a public safety special stabilization fund, which is funded through Riverbridge and Highland Commons. They pay mitigation fees, basically to offset their quote-unquote impact on the town because of, well, Riverbridge is obvious. I mean, you added how many more people to the town from Riverbridge?
204 apartments and 105 hotel rooms.
Yeah, so that's obviously a huge demand on public
So,
safety.
I mean, it could be, what, 700 people? on the
Yeah.
weekend.
Yeah, I think they said it was 15% population increase from it.
Right, so part of the development agreement that was brokered back in the day was that there needs to be some type of payment to offset that increase in cost that it puts on police, fire, and EMS because they're down there all the time.
Well, we have hotel rooms with 5 people in them. You know, I mean, these hockey teams come in, and we have people living at the hotel with 5 people in a room. There's no limit. So, you know, 105 rooms, a lot of the rooms have 5 people in them. That's
It's a lot of people
that's a
down
lot of
there.
people.
It's like a little mini village down there. And then Highland Commons pays us a set amount per year that is adjusted by the Consumer Price Index. So it looks like their payment for FY25, I'm sorry, for FY24, we haven't billed it yet, but it should be just over $700,000. So that's a pretty good payment. They always stamp it paid in protest. And I always put my caveat out there that mitigation agreements are facing a lot of scrutiny at the state level right now, particularly because of cannabis agreements and the fact that communities have tried to pull so much out of cannabis developers. Like, we want a park, we want a playground, we want police cruisers, we want this. The host community fees are even facing scrutiny right now at the state level, because how do you offset an impact? How do you really prove that a dispensary has had an impact on a community? It needs to be quantifiable. So, excuse me.
Some of them are more or less being pushed by these industries that don't want to pay it at the state level because, I mean, basically they negotiate into a contract on this stuff. They wanted to get in, they saw it as reasonable fees.
Right.
And then they're just lobbying to get the politicians to overwrite the contracts that they didn't want to be in the first place.
Correct.
I can tell you the people on Gates Pond Road would be furious if they weren't paying some sort of fee
They don't, Hudson.
for the nonsense they've created in our
I'm sorry, when you say.
neighborhood.
What, you're talking about the shopping?
Traffic,
The Highland
the
Commons?
endless traffic.
Yeah, well, a lot of that's Waze too. Waze introduce people.
Endless,
you don't have to
endless.
get off at 290.
Yeah.
Get off at 62 and shoot down Gates Pond Road. You can get into
Yeah.
Marlboro and Hudson easier.
Yep.
Well, the people of Hudson are pretty pissed at us because they don't get anything from Highland Commons. And half of it's in their town.
Well, they're a lot bigger than us, aren't they?
Oh, sure, but we were pretty smart
Well,
in
they
negotiating the
they
negotiation.
negotiated first. They wanted the development, and we did not. So they only developed on the portion of it that was in Hudson.
Ah,
And
First time it came out, it was still voted
yes,
down.
we voted down Hudson for the terms of the zoning
That makes
change.
sense.
Hudson had it, so then they started going in, and they still were doing the development, and then they came back. And part of it too, we had a lot of resistance of people on Gates Pond Road that were also putting a, organization together to resist any change.
Yeah, we all voted against it,
Yeah.
both times.
right. So when there's an impact or an inconvenience or an outcry from the public, if the developer really thinks they can make a lot of money there, they'll pay. In protest even.
I think the last time I pulled stats for Riverbridge was with Margaret, and I did them for 2 years. I think we had, the police were in Riverbridge over 800 times in the 2-year
Yeah.
mark.
With calls?
Oh, well, we just did it.
Well, between calls and mandatory building checks,
Okay.
things that we have to do.
Wow.
We did.
I don't remember what it was.
And I think it was 88 fire and medical calls, the same thing.
Yeah.
Because they asked me to break it down in emergency calls, and I did it for my site of emergency calls. I think it was like 100.
Yeah, it is.
But you
That's
could interpret those like,
transient.
if I gave them to somebody 20 years younger than me, there would have been 300 emergency calls,
Right.
But I think, because I looked at each call, said, would I turn my license sign around for this call?
Yeah.
Okay, check,
Yeah.
check. And it was quite a bit. And that was before the hotel was even moving,
Yeah.
Hmm.
and
Because
we've
I
had
I think we just looked at the River property on the apartments and stuff, and I think we were almost 50 responses down there for medical and fire emergencies, and that didn't include the hotel, if I remember correctly.
Yeah. So anyhow, that's kind of what just to give you an idea of what the expenditure and revenue sheets look like. I will admit, I did steal them from my predecessor. I liked them because I thought they were simple and
If they
clear.
work, why-
And if it
if they
ain't
work,
broke,
keep using
don't
them.
fix it.
Yeah.
So,
I mean,
yeah.
Don't recreate the wheel.
no.
No, and I think they should be easy for people to understand that don't
Absolutely.
do this every day.
Yeah.
So these are pretty straightforward. It outlines the expenses, the
It's good to
wages.
see.
And that's just kind of what you'll see as we get
And
into
this is
this.
the basis for what will get printed in the annual report?
Right, what actually gets printed is this summary page, which I was just jumping to, but
Yep.
it's not obviously populated with everything yet. And usually these two columns will be hidden, so you'll just actually see what passed it last year.
Yep.
Last year's budget versus the proposed budget. You've got your revenue, your expenses. It'll go into your levy limit, what you're allowed to increase through Prop 2.5, which we can actually go more than because we do have excess levy capacity, but that still increases people's taxes, contrary to some beliefs that are out there. So you don't really want to do that. We did have to go to 4% last year because we were in a bit of a crisis in the spring.
Yeah.
But that had about a $600 increase on people's taxes, which people are feeling and seeing just in time for Christmas this
Well,
year.
the thing was, that increase came after we had a previous increase because of an adjustment in the residential taxes, was it residential tax assessments that
The
changed?
commercial devaluation, right?
Yeah, I think that's what, yeah, it was a commercial,
Yeah.
so it wasn't that we had voted on anything at town meeting, it was just the way the assessors had to do the calculations?
Yes, the Solomon Pond Mall is continuing to lose millions of dollars in value every year. It's a major problem. And one of the things I've been talking to the assessor about is whether we can get together with Marlboro and create some kind of like task force for how to redevelop that property, because apparently there are only 2 malls, she's been doing some research, 2 malls that are profitable, really, in the state right now. Like indoor malls like the Solomon Pond Mall. So, they're struggling, as most malls of that nature are, and we need to kind of look to what we can do for the future, because right now we're just continuing to write off taxes because their values just keep plummeting. So, and then at the bottom line here, you just have your budget, and that's it.
Just a really quick thing, we talked about back to the meals tax thing.
Oh,
So
yeah.
what was mentioned before, so it was TGI Fridays, like, they bet you it was 50-50 kind of in Marlboro and Berlin, so I mean,
Yeah.
we don't have too many restaurants here.
Yeah, we get all the meals tax from TGI Fridays, which is now closed.
We got all of it, yeah.
We got all of it?
Very, very solid point. So I did this before. So we actually just got noticed on Friday about TGI Fridays that they had closed the previous
Did
Tuesday.
they choose a Friday on purpose to notify you?
They might have. I mean, that would be touche.
They closed the one in
So,
Natick too.
yep, no, it's a very valid point. That's something that I should look at too.
What about this place that's supposed to open up down here, the brick from
The
Sterling?
cantina.
Yeah, nothing?
Nothing. It starts, it stops. It starts, it stops.
But, well, I mean, I can tell you, even at Highland Commons, everything open up is on the Hudson side, because everybody wants drive-throughs.
No, well, yeah, but we also got Jersey Mike's.
Yeah.
And we got Crumble.
Yeah, no,
Cooking place.
no.
Crumble's on Hudson.
Crumbles, Starbucks, Panera, losing Chick-fil-A. Panera last year paid $57,000 in meals tax. So Starbucks will probably do the same, and then Chick-fil-A will probably be $80,000.
So they're putting Chick-fil-A on that side?
Yeah, the Hudson side.
It's
What
the
is it,
drive, is
Lowell,
it the drive-through
Right in
that's,
front of Lowe's?
Yeah,
the only
we banned
piece they have
drive-throughs
left, right?
in the town of Berlin. It's something I think that you can't do what's called spot zoning, where you can say, I want it here only and I don't want it here. Because obviously you don't want a McDonald's next to the general store because that would be ridiculous. But having
Yeah.
a drive-through down by Riverbridge where you already have a hotel, why not, kind
Yeah,
of?
yeah.
But you can do rezoning where you have certain districts and you have
Yeah.
development plans for those areas, master plans for those areas, and you could allow drive-throughs in those certain areas. It's been a big, I mean, I'm like stepping on landmines when I say it because I know it's been a big point of contention here. But the folks down at Riverbridge actually built their liquor store with a drive-through window.
yeah, I bet the owner.
Yeah.
Well, I
Which is a
mean,
little
I was looking for a
bit
second salon
presumptuous,
location, yeah.
but
well, I mean, Dunkin' Donuts was, and you could see it way back when they built it, that they designed it so they could easily put
Do
in
a
a drive-through
drive-through.
around.
If
They-
it came
Everything's
to
kind
that,
of was
right.
built with, or with that in mind.
right.
Who would approve that?
Talking the
Zoning?
gas station over there?
Yeah.
Building inspector?
There's not
It would
enough
start with
room.
planning
They
board.
didn't.
But they
didn't
built
leave
it
enough
with
room
that
to
in
put a
mind.
Yeah,
car
two
in
lanes, two lanes around.
If it's
Yeah.
Changing our zoning bylaws
It's
are
there.
one in any town is
They-
one of the
they
most
just did it with
challenging things to do.
landscaping.
Not that it can't be done,
Is it more the process or the people?
both.
Both. Okay.
there. You can't get out of that space
And
when
it
you're at a
requires
hump.
2/3.
Well, that's the whole reason why we should have a drive-through there, so that nobody parks there, we just drive through.
No, I'm,
go.
I'm telling you, there's
Yeah.
going to be there would be accidents. It's really,
We have
it's
accidents
really.
there now.
Yeah,
I should
I
say
know.
Plenty,
more
we
than
I
get
know.
plenty.
Yeah, that's what I've
Because
heard.
You can go through the whole process and go through all the public hearings and everything that you have
Yeah.
to do, and you get it on town meeting, and then somebody's like, but I live down there and I don't want this down there. And I've seen it happen over and over and over again. And it's hard. I get it. You already live there, and that's a change to your neighborhood. It's tough. I see both sides.
And then the last time they wanted it on the town warrant, there's this weird thing, and somebody might be able to correct me on this, that the folks who were doing Riverbridge they wanted to get the drive-through at the liquor / pizza
Cafe.
place.
Cafe.
Cafe.
Oh, yep.
But in order to get that, they had an agreement with Denoria, Dunkin' Donuts, that
Yep.
they would get the first drive-through space. So that there was some weird agreement thing going
I
on.
hadn't heard about that.
That come up during the talk when they were trying to have the Warren article. I don't remember the Warren article.
No, at town meeting, I
This is
think
some of that
it was
background.
just.
But they basically
2020 town meeting.
Oh
yeah,
my
the Riverbridge
God.
said that they had an agreement that they had to have, that they couldn't get the one for the cafe until the Dunkin' Donuts.
I don't
were
remember
rebuilding.
anyone arguing about that issue. It's just people.
No,
came to the
no,
meeting
no.
with-
It was in the discussions
no
leading up.
drive-through.
This was the discussion leading up to
You gotta,
the.
Didn't
you
wanna
gotta be
have-
objective with.
Well, yeah. Mary got to read a statement that Dowd killed the drive-through. Any chance on that one was the fact that they had not paid their mitigation payments. They were behind payment. As soon as that came
I
up,
don't think
to
their
the
taxes had been
let's put it
paid.
this way: is when that came up,
Everyone
immediately
just kinda
there was a
tanked.
line of people going, if you're not paying your taxes, I'm not doing anything for you. They quickly withdrew everything else after that.
Paying
your taxes
is an important thing to do.
They did a lot of articles.
Yeah, yes, they had a budget. They realized that
what happened.
they're.
It's hard to
They
make an
sold their
ask of
liquor
town meeting
license.
when you're not fulfilling your duty of paying taxes.
Yeah,
I
so it
understand that.
ended, yeah, we bypassed these really quick. on that one.
You know my reward for reading that statement.
Yes, I do. You'll get to read all of those statements in the future, too.
It's okay.
You got yourself a new job.
No,
Statement reader.
I got threatened with a suit for defamation.
Okay, so any more on that before any discussion on the OPEB stuff?
Oh, we want to do OPEB, okay. I didn't-
Yes.
Okay.
So I guess we're also known to
Yeah,
police.
if they want to go.
Do you have anything
I-
else?
They might want to hear this discussion. Or they might want
You
to.
don't have to, it's up to
I
you.
don't mind. I mean, this has been something I've been told is coming for the last 29 years of my career here, so.
Oh, there you go.
You know?
Peggy, you stepping up, or what did we
Better
do?
late than never,
I
right?
was just gonna sit back and take notes and wait.
You're sitting in the back? Oh, man.
Is this what you're here for? To hear?
I'm here to listen on all the budgets and get the inside information from the experts.
I thought you were here for the entertainment.
Well, that too.
We try to add a little bit of that if we can. All right, so, now you both were there the other night. I can give a summary, or you can summarize what you thought was most important.
Why don't you give yours first? And then we'll see if we agree or not.
Let's see if we agree. Okay, so we've gone back and forth, the IAC, just really about how should this be structured, what should the parameters be, and in the end, the majority of communities for retiree health insurance split the premiums 50-50 between the retiree and the town. That is what Berlin-Boylston Regional School District does for the teachers. And I think that's where we'd be looking at, there's a few members of the IAC that were not in agreement with that, but I would say the majority were. So we started out, we ran an actuarial study that initially looked at a 75-25 split because that's what our current active employee split is. But that creates a $4.3 million OPEB liability. Now, before I go on, I will say about the OPEB liability, that is a future liability that goes on your books and your balance sheet when you do your financial statements as part of your audit. It is not something you have to fully fund. They just want to see that you're making progress toward, toward that funding. So it's something I would say most communities fund less than 10% of their long-term obligation. But what bonding and rating agencies like Standard & Poor's want to see is that you're consistently putting at least a small amount of money toward that future liability every year. Once you get a little bit of a nest egg, you can invest it in things like PRIT, which require like a $250,000 amount. Then it can grow and it can eventually fund itself. So we were able to reduce the liability to about $3 million if we do 50-50 split. And the annual premium for the town would be about $45,000, and the employee would be $45,000.
In the first year.
In the first year. It does go up slightly, but also your
So per employee?
revenues. No.
No, that's.
Oh, total, oh, wow, okay.
So, Kristen, I want to run that reel back and understand, what do you mean by a $30 million liability? What does that mean? Sorry,
Yeah.
$3 million.
$3 million is your long-term future liability, which means you take all of your current employees, so I think there's 27, can I steal this?
Is it
for a second?
29?
20, yep, thank you. I'm trying to do it off the top of my head. There's all of the current employees, and you estimate if they all were to retire from here, what would your cost be?
Right.
It is an
like a
accounting
forecast.
practice.
Yeah.
It is only a forecast. It is an estimate is done by the GASB standard, which is the General Accounting Standards Board.
So yeah, you're not helping me here.
I'm
So-
sorry.
Yeah.
So let's take
Let's
the
try
lingo.
again.
Let's take the lingo out. Let's
We're
see,
not
let's see if I
connecting,
can
Mary.
make it simple. So what I'm thinking I'm hearing is that you sort of have a pot of money I would call capital, then you have ongoing and expense like we have for other town things that we look at here.
You have an annual premium to pay for the actual insurance, and then
Right.
you have a
45,000.
future liability of what
Okay.
those
So that pot
premiums
of
are going
money,
to cost you
that
down
pot
the
of
line.
money for the
Like a
future
maturity
liabilities
date.
is $3 million.
Correct.
But we're not self-insured on this, are we? Is there something behind
We
the
go
town?
through Maya, is our
Okay.
insurer, they are
Okay.
self-insured. So
Okay.
they insure about, I think, 300, it's almost like 310 of the cities and towns in the Commonwealth. It's a significant number, speaking of monopolies. So your future liability, you're basically, you're putting away almost like two pots of money is one way to look at it. You're putting away your annual premium for what you're splitting
Yep.
with the retiree and the town, 50-50. And then you're also putting away money toward that future liability into essentially what's called an OPEB stabilization fund, which you can also take and invest when you know, if you want to do that.
And they
as
were
well.
talking about having access to, if we're doing those savings, it's invested at a good rate.
Mhm.
So rather than having to come up with the money every year, your money's actually working.
It's compounding and, yeah.
Okay.
So then the 50-50 split we're speaking about is with respect to annual premium.
Correct.
And then the $3 million liability is the town. Yes.
Is
no.
for that's what goes on our books every year as
That's
a
the
future liability.
Future commitment. So basically, once we go into this,
Yep.
the employees, you cannot, first of all, one of the big things to remember this, once you go in, you can't get out. Once
True.
we've committed to this, we are stuck in it.
Yes, you voted
Unless
in a
some
town
state
meeting.
legislation or something that would change that stuff, which
Okay.
you're in.
Right.
So once you've gone in, you've committed this to any of your employees that retire. And the way it works apparently too is if you hired somebody that came into the town and they worked for 1 year and then retired as a Berlin employee, even though they may have had their 4 years of service someplace else,
Yeah.
Berlin is responsible.
I read that part in the presentation, but I just
Yeah.
needed to understand the fundamental financial
Yeah, so they're just
landscape.
looking at saying, you know, how many employees you have, and basically, and then projecting out costs and saying that, you know, and how long these people may live, right? They're just
Well,
doing all their
I-
actuarial studies
Yeah,
and
basing
saying.
it on your current
understand
age
that.
and future
I understand
age.
that.
Yeah.
So for us, in terms of how we look at funding going forward, so we're going to pay a sum towards that $3 million every year, and then we're also going to pay as the town 50% of the premium for that year.
Correct.
So we have, that's the part, just want to get the real basic.
Those are the two boxes.
And two points I took on this insurance thing is that, one, we using these rates, we would be going down to that 50-50 split from the 70-30. So it'd be change in the benefits that active employers are getting right now.
No, not necessarily. This is just for retirees that we were talking about
So-
doing a 50-50 split.
Oh, I thought he was saying that you had to have, the employees and the retirees had to have the same split.
No,
No.
all retirees have to
All-
have the
all
same.
retirees,
okay,
yeah.
so
But you
misunderstood,
don't.
okay.
In fact, most towns don't have the same. They have 50-50 for retirees, and then they have somewhere around a 75-25
Or whatever. We have
or
a
70-30 or
Even
something like that.
60-40, or even 60-40.
Yeah, haven't
Okay.
seen that one too often, but it's.
I happen to work for one of those.
Oh, I'm
Okay.
sorry.
Didn't he also say that the minimum is that, or we have to at least contribute 50%?
Yeah.
Wasn't that we
Yeah, he
can't
said the
go?
minimum was.
That is the minimum. So there's
Yeah.
two sections of Chapter 32B of Mass General Law that you can accept. There's chapter, I forget which one, there's 9A and 9E, I think. So you can adopt either the one that says it's a 50-50 split. If you want to pay more, you can, but you have to adopt 9E instead, and that has to be done at town meeting. So that is your first step. So what was created previously, which is a question that obviously comes up because this has gone to town meeting before, an OPEB stabilization fund was created. But the section of Mass General Law that has to be adopted in order to actually implement the program has not been done yet. So I'm not an actuary, so I can't get into these numbers the way he did, but I will just show you. This is where he talks about the fact that it's about the employer share costs. So this is if you look at the 44,980, that's the employer portion of the premiums each year. And then you have what he's calling your net OPEB expense. So that's the amount on an annual basis that starts accruing that gets you to that $3 million. Let's see where we're at. So this is interesting because he looked at cities and towns and how much they fund. So you're looking at the fact that 72%, I'm reading this backwards. Let me look at his bar chart here. You guys I'm getting dyslexic after these hours. Is it me or is that a really odd looking chart? 72% of cities and towns fund less than 10% of their OPEB liability. Am I reading that correctly?
You are.
And 81% of cities and towns fund less than 20% of their overall OPEB liability. So I love that. So then he did a comparison of us to Bolton, Lancaster, Sterling, Holden, and Princeton. And one thing he mentioned is that our health insurance plan is richer than some of these communities. It is a higher benefit. So one of the things that the select board asked that we look at is a couple of ways to reduce and make some savings that would offset that $45,000. One of the ways that was talked about was, could we look at plan redesign for active employees? Could we look at eliminating health insurance for elected stipended board and committee members? And could we look at selling buildings was another one that was a very good one over there, because we're in the process of doing facility study that is showing that some of our buildings, the cost to keep them or repair them or even just look at them is far outweighs the value of actually keeping them. So if we could sell them, get a little bit of money, we would go from, you know, being in the red to being in the black, basically. And we could potentially put some of that money towards, you know, not directly, but we could offset some of these costs. So as it shows here, basically you're looking at 29 employees and your cost, and they do break it down by department, just in case anybody's interested.
Yeah, he said this was
It's just
extremely
a-
skewed because
yeah.
our numbers are so small.
Right.
He actually, I mean, his numbers are based on what the age of those employees are today. So he said
Yeah.
because of that, it's
Yeah.
like you
We're
can't,
screwed.
Yeah,
you
let's
can't
just-
really, you can't calculate.
It's-
different-
You guys are
it's
sinking
not
the
a good
whole thing.
sample.
Yeah, and yeah, we're just too
They're all like
small for any of
24
that.
years old.
Right.
One piece that I learned from this that I was, because as much as I'd only been, you know, told this pieces here and there,
Yep.
was besides being a cover, I was always under the impression it was just for the gap year between when they actually retired until they reach Medicare. They are required to, once they are eligible for Medicare, to go on Medicare, but it also funds a supplemental once they're on Medicare, which is something that I was
Yep.
caught off guard on that one. That was completely new to me.
Yes, and that typically is 80% less than the cost of the town's plans, because now Medicare is your primary, that's a federal government paid plan. And when you split a Medicare supplement plan 50-50 with someone, it's a significant cost savings as opposed to splitting one of the town's plans 50-50 with somebody. So, but yes, that's typically how cities and towns do it.
So the supplement that we would fund as a town would correspond to that Medigap,
Medi-
Medicare, Medigap insurance.
Yeah, it's
which
called
is-
MedX2 is what we
Yeah.
use right now.
Yeah, and which principally covers that out of pocket, the sort of things that the basic Medicare isn't going to do. And
Correct.
so, yeah, I would think that would be a pretty small number. I don't think that's significant
Yeah,
in this.
but it is
equation.
something that still was, well, you're going to be paying that possibly a lot longer, right? Was he at 65? You know, somebody lives to 100, over those.
Well, I can
Wait,
tell
yeah.
you the national average of a retired police officer is 56 years old,
Yeah.
so.
So,
You know, see
but
how
don't,
we're the highest.
don't sink
today.
yourself though, and I'll tell you
Yeah.
why. I was just going to retirement prior to age 55 for that point. And I say, for example, public safety personnel are eligible to retire at 55.
yeah.
Often though, they defer receiving their pension because they take another job, say as consultants in the private sector or what have you. If they do that, they're not eligible to receive retiree health benefits from the town until they take their pension and end their deferred retirement period. You have to be pulling a pension from Worcester Regional Retirement to be eligible to receive retiree health insurance. So that's one thing to point out, because for a lot of people, I think there was this fear of like, it's scary enough to go from 60 to 65. Now you're talking about going from 55 to 65. You know, there's even more of a gap to bridge there. There's also, so this talks about Medicare too. At 65, retirees would be required to move to a Medicare supplement plan, which reduces the cost of insurance by about 80%. And then here it is. So we would have to adopt either Section 9A or Section 9E of Chapter 32B. One authorizes 50% and one authorizes more than 50% of the premium. I mean, let's be honest, I don't think we're talking about 9E, I think we're talking about 9A.
Yeah.
So there's an interesting attachment to this that I won't show right now, but about The real problem we're running into is that it's expected if you work in Massachusetts for a municipality that this is a benefit that you receive. And I get that it's not a private sector benefit and nobody likes that, and I understand. But unfortunately, just like there are certain perks with certain other jobs where you get bonuses once a year or you get shares and you know, stocks or whatever, this is something you get when you are a public sector employee. So when you come here and you find out we don't have it, the question is, well, do I stay? Do I go? What do I do? And I just think the challenge is, how do we look at employee retention, remain competitive when all of our surrounding communities and 95% of cities and towns in Mass are funding it?
Doing it, yeah.
And let's be real about which 5% of those towns that aren't funding it. They're all out in Western Mass in their towns where their town halls are open like 10 hours a week.
What, is it 5%? Because the number that was being thrown around was saying specifically was 5 towns, but they weren't saying
No,
percent.
it's a
So
little
that's,
I've got the,
I mean,
I actually
5%,
have the
what
sheet.
was, there's like 312 towns or something like that. Is it
Yeah.
350.
There's a number of
351?
little
All right,
ones
so
out
you're
in
looking
Western
at-
Mass that
So
don't
like
pay
17
it.
or 18 is the actual raw number.
So, to make it more Berlin-centric, are there any towns in our sphere of influence who are like us that don't offer it? Are there any?
So he, not that I'm aware of, he
There are
looked
none.
at, so what did he say in the study?
Because we dealt with this on the school committee when we were regionalizing.
There aren't
Because
any.
Berlin teachers didn't have that benefit.
Bolton,
There's-
Other
Lancaster.
teachers in the district
There's your
did.
first example of it. Now, here's the second example.
Yeah.
So here we go. What did he say now? He said something earlier about the towns that were
Pretty-
around here. I tried to put
pretty
it in
clear.
here.
He has
what to do.
Bolton, Lancaster, Sterling,
Those are the
Bolton.
ones that they just compared.
Are they just?
No,
So
but
they're
he
not-
at one point
they're
gave
not
me a list
ones.
of the towns around here that had it, and I just don't have it in
It's
this
easier to
document.
get a list of the ones who don't have it.
Yeah, so there is a huge list, but I will tell you the list is a little hard to follow. It's also from 2021, and it's this 16-page report that tells you who funds it, how much they put in, and then you'll see like Ashby, no plan. And then you'll see.
I lived in Ashby, no surprise.
There you go. Then you'll see Berlin, but there's this no information as provided at date of this report, so it's not a complete report because it should say no plan for Berlin. So I don't know how many of these other towns that have that cross next to it actually don't have
You got
plans.
Bolton there, yeah.
But Brookfield, if we're starting to get out west. I
Brookfield
don't know where
offers it.
Charlemont is.
But they're all west. right?
Yeah,
Charlton.
that's.
Charlton, yeah. Charlton offers
Chester.
it? Wow.
No,
Ernest.
oh yeah.
Ernest.
Clarksburg. I haven't even heard of some of these
Charlton
places.
offers it? Wow.
Charlton, Leicester, Oxford, Auburn, every town around there
Yeah.
offers it. Dunstable doesn't have a plan.
Wow.
It's
God,
interesting.
another place I've lived.
It's right next to the road.
Well, that doesn't surprise me.
Florida.
You been to Dunstable?
Don't go to Florida.
No,
I know
no.
everyone likes to snowbird there, but
No,
no. I get punchy after 9. I've warned everybody this. Gosnold.
Yeah.
So you could see. I
didn't
mean,
live there.
Hollywood,
You're talking
Hancock.
communities that are probably under 1,000.
Correct. You're talking like
Really,
the
really
Hollands and
small
the
towns.
Wales and the really small towns, predominantly in the Berkshires,
Yeah.
that don't necessarily even have your standard form of government or, people that you can call up and talk to during the day at their town and city halls.
I mean, I go to meetings with the Mass Chiefs, and there's departments literally have 3 town names on their badges.
Yeah.
You know,
They
and-
combine a lot of them.
And it's like 1 chief and like 1 officer and for 3 towns.
Yeah.
Well, one of the other things, this is more a comment, I think it's coming from the IAC, I can't talk either, does it? IAC committee, was, they were looking at different things, and this seems more like a soft number, but it seems relevant to everything else that keeps coming up over the last few years in staffing, was the impact that not being able to keep people after they've worked here for a while, and then they have to say, oh, I'm going to retire. I need to move on because I'm not going to get a benefit I need in retirement.
But these are hard financial numbers to arrive at that cost. I mean, you could probably spend some time doing that. It's significant, but people don't bother to measure it because it's not the kind of thing you can put on an Excel
Yeah,
chart.
but
I've
it
tried
was-
to quantify it, to be honest,
hard.
and unless I,
Yeah.
put a ton of assumptions in it and spend like days on it, I don't think
Yeah.
it's a good use of my time, frankly.
So I'll use myself as an example. For the last 19 years, I haven't taken health insurance from the town. I'm 41 months away from having 34 years on at age 55 where I can retire. I will not be able to retire because I won't have health insurance. If there's an opportunity before I reach that, right now I'm at 141,000. You're looking at 167,000 right now on average to bring a new police chief into this town. For me to walk out the door to go to another community just to get retirement health insurance is going to cost you $26,000 a year.
Right.
Just myself. That's one employee. And you're looking at 45,000 to cover multiple.
So Eric, I'm not even talking about that. I'm talking about the cost operational that's really hard to measure, about knowledge of the town,
Oh, yeah.
interactions with
Yeah.
other people,
Yeah.
all of those personnel costs that are not dollar measurable, and they're
Yeah.
enormous.
But every time absolutely, but your point is very valid. We've
Yeah.
had to bring on a lot of new
Experience.
employees, and we have to pay them at a much higher rate than existing
Yeah, the
employees.
average
That-
entrance
that
right
you
now.
can measure,
yeah,
yes.
Yeah, through our study, the average entrance right now for a chief of police is 167
Yeah.
to walk into a community. Yeah.
Yep. Yep.
So, like, if I walked out, like, right there is 25 grand, 26 grand.
But the experience is absolutely right. I mean, and you know, basically, and Parker said this, so don't shoot the messenger. He said, you're really trying to decide, do you want to be competitive with your neighbors, or do you want to be a training ground?
Yeah.
So can I,
But like, I just want to remind everybody, like, not everybody, like, I haven't taken, well, it'll be 20 years. Yeah, my daughter will be 20. So, almost 20 years, I've not taken health insurance. This town has not paid a dime of my health insurance in 20 years, you know? So for me to actually fulfill my career and say, hey, you want to cover me for 10 years? And the town go, yeah, no. Like, it's kind of like a kick in the teeth, you know? I you know, but I wasn't alone in the department either, you know? In my younger years, you know, when I first started, very few of us took health insurance from the town. Spouses had better plans, you know, so.
That's real common. Yeah.
Yeah, I mean, you know, so I don't, it's kind of like, you know, well, my kids will be out of college, they'll be over 26, I won't need a family plan, I'll need a single plan, it's cheaper to get 2 single plans than it is a family plan, you know, so like, you know, it's a big thing for us too, you know, like when we look at it, you know.
no, all of this is rational, you know, this proposal. Can anybody speak to the discount rate? I'm looking at the comparison to our peers, and our discount rate is 4.13. Everybody else's is higher, although we're close to the Massachusetts average.
Because our plans are
And our discount
richer,
rate
is
is
that-
going to tell us what that annual
Hold on.
funding amount is towards the town liability. If you got a higher discount rate, you have to pay less each year, don't you? Or am I confused?
We talked about the discount rate. I thought it had something to do with how much the plans cost, but I can't speak to that one unfortunately to tell. I can get you the answer though.
Well, I'm just curious directionally. I know what I was forced to take some finance stuff when I was working.
I mean, the only description it gives is on the, on
There's a
this page
definition here.
here, but it's only just saying
What page
interest.
is that on, Scott?
It doesn't have page numbers, so,
I saw the definition.
it's on 1, 2, 3, 4,
Oh, there it is.
page
It's
5.
the blue blocks, yeah.
Right there.
Interest rate used to calculate the present value of future cash flows, right. So I think the bigger the number,
Oh, here we go. How is the discount rate determined?
Multiple factors.
Exactly. 1, 2, 3, 4, 5 points.
So employer share of the cost, which would be 50, we're talking about 50%. Our bond rating is a AA+, which is basically the highest bond rating you can have for a community of this size. Your assets that are currently held in a trust, well, we're starting at 0, so that probably lowers it. How much you're expected to contribute to OPEB every year. It all depends. My recommendation was to follow that free cash policy and do the 10% per year, but I recognize, as Scott and I discussed, it's a new board and not everybody has necessarily been on board with that or were here when that policy was put in place, which obviously merits
Yeah,
discussion.
I mean, Mary, were you involved
Oh, yeah.
when that was put in?
Oh, yeah.
Okay, on the free
Yeah.
cash thing? Okay. I
Yeah.
think you're the only one that's still existing.
Okay.
We really haven't, and we
Margaret
haven't
laid that
discussed
out.
it since then.
Yeah, Margaret laid it out in the very beginning.
Okay.
Before you were
No,
on,
and I
she
didn't
laid
even
it out.
realize that. I was
Yeah.
thinking you all had been on longer. I was thinking you two were just our newbies.
Yeah.
Who, me and Scott?
No.
Oh, those two, yeah.
Yeah.
Yeah, we're
Yeah, I had that gap. So the other thing, there was two other notes I had from it. One, we kind of somewhat covered. We talked about like the pension stuff, how it's very much different than the pension. And the fact that you only have to, the minimum you need to contribute is what the actual cost of the premiums you're paying for retirees at that moment.
Correct.
Unlike pensions, which you need to cover, whether they're gains or losses or that stuff, and you get your bigger assessment each year as they assume more and more losses.
So that
And,
45 goes into the budget.
Yeah, so right now, there's nothing in the state that's like the pensions or that stuff. There's less regulation on it in the sense of, the only thing we have to put in, like I said, assuming that be the $45,000 number. The other one, which I just referenced, with my note, just a second, before I get back to it.
That's just a cover letter. It's not anything else.
Oh, the other one was the cost. You do have some control in the future is that you can change, adjust the plans. So that's your only cost mechanism, or way you can control future costs is, well, obviously.
Plan redesign.
Right.
Which we
the
did
plan
last
redesign.
year with
So
the
that is
active employees.
You do have an avenue for controlling some of your costs.
Now, was
but
I
only through that method.
understanding that the retirees and the active employees have the same plan? Or can you have separate plans?
Yes and no. There are no. There's a plan for retirees. There's a plan for active employees. Retirees go on a calendar year typically. Active employees go on a fiscal year. So they're two separate sets of plans. But I said yes in a sense because until you get on Medicare, you are still on the more expensive town plan. But it is a plan that is designed essentially for retirees.
But you wouldn't have like a cheaper plan for the retirees than you would for the employees. They would all, for the active
They're two
employees.
separate plans, actually. So when you do retirees,
Well, I'm going to speak as a
Yeah.
retiree from
Yeah.
a municipal body. So they have two sets of plans. Active. Actually, I have multiple sets of plans. Active employees, retired employees, pre-Medicare,
yep,
and then retired employees
with
Medicare.
Yeah.
And so it's three different insurance plans, and in some cases, not the same carriers. Because I retired from Sudbury, and Sudbury uses GIC, so the General Insurance Corporation. So those plans are laid out there, and they just buy into that system.
Right. And you can't change anything about those plans.
No.
They are the way they come.
They come the way they are. But the cost is only cheaper to the retiree because the cost is being shared with the town.
Okay, so the town's getting a
cheaper
saving by
plans.
having a larger number of insured people, whether or not they're retired or active, but the plans are different.
We're part of Maya, so
Yeah.
it's pooled health insurance, right?
Yeah.
So because we're small,
Mm-hmm.
we get put in with a huge amount of other cities and towns, and they do an average rate cap for everybody. So
Mm-hmm.
like last year's cap was 10.5%. Our claims for and they look at back 2 years. Our claims happened to be high enough they could have done a 27% increase, but because they had capped the pool at a 10.5% increase, we actually benefited from that. So.
Yeah, it's essentially the same concept as GIC.
So in our case, it wouldn't really matter the number of employees or number of
No.
recipients that we have on the plan.
What matters are your claims, really, and that's what drives whether your premiums go up to that maximum cap that Maya sets every year, provided you stay with Maya. There are other options. I wouldn't recommend it, though, because we're so small. Again, you're in a big pool and it spreads everything out. It makes more sense.
And to go back to something that you said, there also is a supplemental plan.
The MedX,
Well, they don't call it MedX. It's called something else. And so I have a supplemental plan. Mine's through Harvard Pilgrim. We have like 2 choices, I think. But essentially the cost is the same.
Yeah. But you're right, in Leicester, they had the, like, active employees were on a Blue Cross plan and the retired employees were on a Harvard Pilgrim plan. Because you go out, at Maya will go out in the market and look at what's cheaper that year. And they are split up, like you said, as separate plans, so you can end up with different insurance companies.
And every year it changes.
Yep.
You know, like Harvard Pilgrim may not be available next year, so we get a notice.
Or Fallon goes out of business.
Or when Fallon went out of business, you know, and it's by county where you live, not where you retired from. So I live in Worcester County, but I worked in Middlesex County, but I have to stick with the Worcester County programs.
All right, so I think it comes down to now is, I mean, we have more information on this, and I think the select board still has more decisions to make on how they're thinking about funding it. And like I said, you just ran through different things of putting in for that liability, whether it's selling land, whether it's going through and removing elected officials, stuff like that. There's a lot of pieces still being discussed.
Yep.
And we know, I mean, we have the, what was previously set by the Finance Committee. I think we understand that. I think we should just wait until more information is select board. And I mean, it's already kind of set as a standard there for the free cash thing, and since it was done previously, and we could just go look at reaffirming that vote, or at a time when we may have more information.
I would say, and thank you, I appreciate that. I would say that I heard pretty clearly from the select board that rather than take at least the annual premium for free cash, they want to see a reduction somewhere else in order to offset that. Where I would think we could use the free cash would be perhaps to fund a portion of that future liability.
My assumption, until you just said that, that was my assumption that what the proposal was in the free cash thing was funding towards that liability, that like the $45,000 or the annual premiums would be coming out of the regular operating budget. That's not coming out of free cash or anything, some other method.
Yeah, that's right.
Yep. I just wanted to clarify.
So I'm looking at our guidelines, use of certified free cash. And we had a special note here, Kristen, that we were going to direct 10% towards OPEB trust fund. But because it was not yet established, we were going to allocate temporarily to general stabilization. And I don't know if that is in fact what we have done.
I don't know either.
This is where June is really helpful, isn't she? Yeah.
I don't recall we have put anything into general stabilization in terms of the 10%.
I asked
since I've been on the committee
last year. I said, so can we take that 10%, put it away? And the answer was no, just let it flow to free cash and roll over to the next year.
Yeah.
So not pointed at general stabilization?
No, we were just putting the amount recommended for general
Well, they're
stabilization.
10% each, right?
Yeah. So no, we haven't been putting more than 10% in general stabilization.
Okay.
It would be prudent, but, until the town makes a decision on where they want to go with this, I understand why people didn't want to set aside funding for it. I get that.
So we put that OPEB 10% into special education, didn't we?
Well,
We let it roll over to FY24 free cash.
there was lots of things that impacted last year.
I know. Don't, forgive me, I shouldn't say things like that.
All right, so do we want to get to A more on that? We can move to the last item of business, which is to do our meeting minutes, to approve those. So do we have
I'll make a motion to
approve. We have a second?
Second.
All right, so any more discussion on it?
No.
They're pretty basic.
Introduction.
Yeah.
I
All
said-
right.
Yep.
So roll call, Scott, aye?
Mary, I.
Julie, I.
Cliff, aye.
Shane, aye.
All right, passes 5-0. And that's it, unless
All right.
there's any other business.
Motion to adjourn?
Yes.
Did I jump the gun?
Yes.
Good.
All right.
Get ready for work. All right.